this hearing to order. For the record, my name is Kenzie Bach. I'm the District 8 City Councilor and also the chair of the Boston City Council's Committee on Boston's COVID-19 Recovery. This public hearing is being recorded. It's being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. We'll be taking public testimony at the end of the hearing, so if you're interested in testifying here with us in the chamber, please sign up over there. There are sheets near the door. And if you're interested in testifying virtually, please send us an email at ccc.covid19@boston.gov, and we'll get you the virtual link. So again, that's ccc.covid19@boston.gov. And that's the same email address where you can send written testimony, either during the hearing or after. If you see this tape later, you're welcome to continue to submit written testimony to us. Today's hearing, I'm going to read a couple of dockets and I'll just explain what we're doing. So today's hearing is on docket 0503, message and order authorizing the City of Boston to accept and expend the amount of $349,500,000 in the form of a grant awarded by the United States Department of Treasury to be administered by the City of Boston's Chief Financial Officer, Collector Treasurer from the Coronavirus State and Local Fiscal Recovery Fund in the Treasury of the United States, established by Section 9901 of the American Rescue Plan Act of 2021, ARPA, and pursuant to the requirements of the ARPA, the grant payment would fund COVID-19 response and recovery efforts and accelerate a Green New Deal for Boston through once-in-a-generation transformative investments that address the systemic health and economic challenges in the areas of affordable housing, economic opportunity and inclusion, behavioral health, climate and mobility, arts and culture, and early childhood. And then docket 0504, message and order authorizing the City of Boston to accept and expend the amount of $40 million in the form of a grant awarded by the United States Department of the Treasury to be administered by the City of Boston's Chief Financial Officer, Collector Treasurer from the Coronavirus State and Local Fiscal Recovery Fund in the Treasury of the United States, established by Section 9901 of the American Rescue Plan Act of 2021, ARPA, and pursuant to the requirements of the ARPA, the grant payment would fund provision of government services to the extent of the reduction in revenue of such state, territory, or tribal government due to the COVID-19 public health emergency relative to revenues collected in the most recent full fiscal year of the state, territory, or tribal government prior to the emergency. So those two mouthfuls are the administration dockets. We're actually mainly focused on the first one, the $349.5 million, which for folks watching at home, and I know all the councilors have heard me say this already, but basically that's kind of the remaining amount of undesignated general funds that came to the city from the American Rescue Plan Act. So it's distinctive from, you may have heard about funds for rental relief. There was a specific $50 million for that, distinctive from some specific funds that have actually come to our Public Health Commission for various purposes. We've had funds go to the Age Strong Commission where the Fed said, here's money for a specific thing. This is general money that, although there are restrictions on how we spend it, they're much more general, and so there's a lot more options for the city. And so the administration put forward a proposal back in mid-April at the same time as they filed their budget for how to spend this money. And what the COVID-19 Recovery Committee is doing is sort of digging into those proposals and separating them out by chunks, because $350 million is a lot of money to talk about all at once. And you heard me read through those 8 categories. And also, at the same time, you know, we're trying to make sure that we also discuss councilor ideas for how to spend this money, because it's one-time funds, and I think everybody feels a sense of the need to get this right and make sure that we're spending it in really impactful ways. So to that end, we also, at each of these committee hearings by topic, we're co-noticing any councilor dockets that have come in that are in this category, and that's because those may be topics that come up today as councilors are discussing with the administration kind of comparative value of spending money on different things. So I'll read those dockets in a second. Just to be clear, several of the council dockets, we haven't had like a proper hearing of their own on, and we still intend to do that for councilors who want it. So for instance, like this morning, we co-noticed the one about municipal composting with the climate agenda, but we haven't really discussed that issue in depth yet, and we plan to, and so there are a couple that I'm about to read where that is likely also the case. So docket, in addition to those 2 mayoral dockets, we have docket 0265, order authorizing the City of Boston to accept and expend a grant funded through the Coronavirus State and Local Fiscal Recovery Fund in the Treasury of the United States, established by Section 9901 of the American Rescue Plan Act of 2021, ARPA. That is a docket sponsored by Councilor Baker, which we have had a dedicated hearing on. Then docket 0590, order for a hearing to discuss ways in which ARPA funding can support an ecosystem of nonprofit holistic wraparound health services for disenfranchised populations. That is a docket lead sponsor, Councilor Fernandez-Anderson, which we have not yet had a dedicated hearing on. And then docket 0638, order for a hearing to discuss the possibility of allocating ARPA funds for the expansion of South Boston Community Health Center. That's a docket lead sponsor, Council President Ed Flynn, which again, we have not yet had a dedicated hearing on. So for anyone watching at home, this isn't the hearing on those things, but we wanted to make sure that, we're having a joined up conversation, and so we co-noticed the council docket so that people could know what kind of is in the mix thus far. So I'm joined here by my colleagues, Councilor Erin Murphy, at-large, and also the chair of our Public Health Committee, Councilor Julia Mejia, at-large, Councilor Tanya Fernandez-Anderson, District 7, and Councilor Liz Braden, District 9. And today's hearing, I should have said at the outset, is focused on the ARPA dollars in the public health and behavioral health buckets. So with this hearing today, we will have covered all of the initial buckets proposed by the administration. We did climate and mobility and digital equity this morning. We did housing on Wednesday. And last week we did early childhood, arts and culture, economic inclusion, and I think that's all of them. So with the conclusion of today's hearing, this kind of like introductory just period of going through the proposals, we will have finished, and then we'll have continuing hearings as we figure out what to do. But I'm delighted to be joined here today by Dr. Bisola Ojikutu, the Executive Director of the Boston Public Health Commission, Tim Harrington, their Director of ANF, and Jen Tracy, the Director of Recovery Services. I think we also have PJ Can, Deputy Director for Policy and Planning, on call, and I imagine there may be some other Public Health Commission staff on call in the room, so thank you all for the work that you do, and we look forward to hearing you as appropriate. And I'll just note that we do have folks signed up for public testimony, and I will probably be aiming to at least take the folks who are initially signed up, because we have 6 people signed up right now. I'll take those people after our first round of counselor questions. If further people sign up, we'll wait until the end, but I want to let the folks who are here already know that at least after everybody on the council asks their first round of questions, you'll get a chance to testify. So now, without further ado, I want to hand the floor over to Dr. Ojikutu, and thank you for joining us.
Great. Good afternoon, Chairperson Bach and members of the City Council. Thank you for the opportunity to testify before you here today regarding the Boston Public Health Commission's ARPA spending proposals. For the record, my name is Dr. Bisola Ojikutu, and I'm the Commissioner of Public Health for the City of Boston and Executive Director of the Boston Public Health Commission. And I'm joined here this afternoon by Tim Harrington, BPHC's Director of Administration and Finance, and Jennifer Tracy, who's our Director of Office of Recovery Services at BPHC. And I was hoping to pull up some slides. Okay, great.
And councilors should also have those on their email if you want to pull it up on your computer for people.
Okay. Is everyone up?
Yeah,
we have them. We ready to go? Okay. Okay. So the proposed investments that we will outline today are all eligible under ARPA criteria and address major urgent public health challenges in Boston. These include COVID-19, mental and behavioral health, and substance use disorder. We're committed to using these funds to implement what we see as transformative solutions to these challenges in a way that plans ahead for the fact that these are time-limited investments. I think that it's also important to emphasize that ensuring that all of this work is carried out with a focus on equity is incredibly critical for Boston's healthy recovery and is essential to each of these investments. So let's start with COVID-19. While the state of the COVID-19 pandemic no longer constitutes a public health emergency, our pandemic response efforts as a city continue. So what I provided here are trends in relatively recent data. If you look at the 7-day trends, essentially what we're seeing is that the viral concentration in the wastewater regionally is trending downward. Case rates are also trending downward, and hospitalizations are stable. All of this is hopeful news, but we are continuing to follow these data very closely. We anticipate that there will be an ongoing need to implement a citywide response to COVID-19, and it's important that as a city we are prepared. So turning to what this means for this round of ARPA investments, our focus is on continuing to ensure an equitable response, as I mentioned, focused on residents who are at highest risk and who are most vulnerable, particularly in the setting of a surge. We need to ensure that our recovery is, as I said, equitable, but it also depends on our ability to address disparities by race and ethnicity and by neighborhood. Much work has been undertaken thus far to address disparities, and on this slide we've included the percentage of Boston residents who've received one dose of a COVID-19 vaccine by race and ethnicity on your left and by neighborhood on your right. So what you see here is the sum of a lot of work that's gone on at the Commission as well as beyond with our many community and academic and health center partners. And we certainly still, have a lot of work to do to overcome disparities. FYI, just as a city, we are approximately 74% vaccinated overall. Also regarding vaccination, but not on this slide, approximately 54% of fully vaccinated individuals in Boston are boosted. And we're well aware that that percentage is suboptimal, and we need to continue to ensure equitable access to boosters, as well as increase health communication to communities, emphasizing that boosters are essential to prevent severe illness, hospitalization, and death from COVID-19. There continue to be very stark racial and ethnic disparities in vaccination uptake amongst 5 to 11-year-olds, which we have been working very closely with BPS to overcome. It's been a long process, and we are making some progress. And then we also need to prepare for new challenges regarding the rollout of vaccines for children under 5. We anticipate that they will be authorized soon, this summer, maybe even this month. And we will continue to work closely with our community partners to address parental hesitancy and ensure that accurate information is available, particularly within our most vulnerable populations. We know from experience that we cannot address health inequities alone, and that's why the plan that we have proposed, and which I will outline, relies heavily on leveraging the strengths of community-based organizations, community coalitions, and our community health centers. So regarding vaccination, with new ARPA funding, what we plan to do is to strengthen our ongoing COVID-19 vaccination efforts. Much of this effort will be focused on funding the CHCs and other local community partners to support a wide range of vaccinator-related efforts, and that includes community education, outreach, as well as administration of vaccines. We also plan to support vaccine ambassador programs, particularly amongst younger individuals, educational events and activities, and the development of new educational material. And that's really been the core of our vaccination efforts thus far, and we will certainly hope to continue to move those forward as we continue to address disparities as well as issues that we know are going to come up in terms of vaccinating younger individuals. Turning to testing, COVID-19 testing continues to be a critical mitigation tool. It's really important that we have access to both PCR standing testing sites as well as rapid testing for ease of use. We recently reviewed applications for an RFP for our testing and vaccination partners who will be able to help us scale up rapidly and be engaged during periods of surge and quickly respond to community needs. We're also building a new capacity to support test and treat, which will connect individuals who test positive to treatment quickly, and that particularly includes oral antiviral therapy, which is highly effective at decreasing severe illness and hospitalization. So specifically with this funding, we plan to continue to offer free PCR and rapid COVID testing throughout the city, but we are focused in on neighborhoods and populations most impacted by COVID-19. We also intend to use portions of this funding, as well as I mentioned, portions of the funding that we're asking for vaccination, to fund community health centers, to build sustainability, to build their capacity, to do this work within their settings and amongst their catchment area. So we can't do this work without continued staffing capacity within the Commission, and we are essentially asking for funding to continue contracts for critical public health nurses who will manage outbreaks, do case investigation, and help disseminate clinical guidance to partners. It's also very important that we continue to uplift and amplify the need for health literacy materials in various languages, that we have the appropriate, streamlined communication to reach individuals who may not be reached using other channels of communication, and that's really our role. So we're asking for funding both to fund critical public health nurses and to enhance our ability to reach populations who may not be reached with specific health literacy materials. In addition, as you all are aware, we do run 2 large shelters. We plan to do some work in those shelters, particularly looking at deep cleaning, making sure that those are safe places for people to go, and to make sure that frontline staff workplaces are also regularly cleaned. In addition to COVID staffing, we also know that we have served as a primary source and a resource for people in terms of personal protective equipment. And we would like to ensure that BPHC staff, clients, and our communities are safe through ongoing access to personal protective equipment. So what we would like to do is to have enough PPE available, particularly for staff who are providing direct services, especially those working with high-risk populations, and for external partners, those working, including community health centers, as well as those working across the city in various city departments. So another investment proposal that I think is really important relates to viral wastewater monitoring. This has been an incredibly important tool that we've used, and I just want to emphasize that, some of us were just recently at a meeting with other cities and city health commissioners, city departments of health, and Boston and Massachusetts in general really have been leaders in terms of the use of viral wastewater data to guide our response, to be able to predict where things are going, and we're putting that information and really working hard to increase our communication and our literacy around how best to use viral wastewater monitoring. So because it's been such an important tool, what we would like to do is not only have regional information, we would like to have more granular information related to what's happening in Boston. So what we anticipate doing if we're awarded this funding is to actually have sampling sites at 10 different neighborhoods, within 10 different neighborhoods around the city, because we also know that some neighborhoods are not accessing testing, so it's very difficult to know exactly what's happening within neighborhoods, and we want to be able to implement a solid response that promotes equity. In addition, we've thought also about, if we have outbreaks in certain schools, could we be sampling the water there so we know when there are changes, when there are fluctuations, whether or not there's actually spread from the community to the school or from the school to the community. All of that work can be done, and we've talked with our partners about this, and this money would be used to move that strategy forward. Another proposed investment will specifically focus on community health centers. As you heard, we are really looking to utilize our vaccination and testing funds to support and build capacity at the community health centers. This amount of money that I'm going to describe is focused very specifically on CHCs. What we know from our many conversations with our CHC partners is that many people have been disconnected from care or have deferred care throughout the pandemic. Our community health centers have been hard at work throughout the pandemic to ensure access to testing, vaccination, treatment, and other services, and are now working even harder to re-engage people into care and to address all the unmet needs that have sort of built up over the last 2+ years. So we've been working closely with our CHCs to understand their unique patient needs and how best to build capacity to meet those needs, including directly related to COVID response, but also to think beyond COVID to COVID recovery and all the needs that are bubbling up and that are certainly important to make Boston an extremely healthy city, which is our overall goal. So how we plan to use this funding, basically, one, to support community health centers to ensure access to care, particularly for those who've been disconnected from care because of COVID, and that might mean, patient navigators, community health workers, other resources to increase access. And then to make sure we're focusing on neighborhoods and populations who've been disproportionately impacted by COVID-19. So I'd like to turn to behavioral health. I know that I've spoken to most of you, if not all of you, here today on the City Council about our need to amplify the needs within the behavioral and mental health realm to make sure that we're meeting the needs that have come up in many different circumstances, both from community meetings as well as various different data sources. Just to give you a sense, in the 2019 Boston Community Health Needs Assessment, mental health was amongst the most urgent health needs of residents, and this was pre-COVID. Behavioral health was also prioritized in the 2020 Community Health Improvement Plan. And we also know that because of what's happened in terms of racism, institutional structural racism, and COVID-19, obviously all of these needs have been exacerbated, sorry about that, and that we know that though these persistent mental and behavioral health disparities have existed, certainly they've gotten worse. So what we would like to do is to utilize ARPA investment dollars to build a center for behavioral health and wellness basically housed within Boston Public Health Commission. This new entity is not brick and mortar. The plan is for it to be a place where, or an entity within which we can collaborate, we can strategize, we can think about new interventions that can be a resource not just to BPHC, but a resource to the entire city and to communities who are looking for needs or looking for resources such as this. We're in the process of shaping this initiative. This center is in evolution. We're at very early stages, and of course, we're hoping for this funding. We certainly plan to deal with many different aspects of mental and behavioral health, and I'll talk through some of them, but I just want the City Council to understand that as this process is in evolution, we certainly want to deal with many different aspects of mental and behavioral health, including these issues across the lifespan, the age span, youth mental health, veterans mental and behavioral health, as well as the elderly. And so we will have more to say about this in the coming days. So as I mentioned, we know that we need more behavioral health services across the city, but again, the center is not meant to be a brick and mortar sort of site for service delivery. Rather, it's an opportunity to collaborate and invest in strategies that will ensure long-term sustainable solutions to Boston's unmet behavioral and mental health needs. The goal of the center will be to develop innovative prevention and response models to mental health, substance use, and health and wellness that address systemic racial inequities through a comprehensive, coordinated citywide response in Boston. The FY23 requested city non-ARPA funds are specifically meant to bring on people. So we have new leadership that we are bringing on, including a chief behavioral health officer. This is a first-time position at BPHC, a first-time position within the city, as well as 3 staff members to support planning, expansion, coordination, and response within Boston Public Health Commission bureaus to provide services and some of the critical pieces strategies that we're interested in implementing through the center. So in addition to these funds that we've requested to the city, these ARPA funds will enable the center to focus on 3 initial critical priorities. 1, expanding the behavioral health workforce. 2, capacity building and training programs across the city departments, as well as community partners. And then 3, enhancing public communication. So I'll start by saying a little bit more about workforce development. What we know from surveys, from focus groups, from talking to our hospital and our clinical partners is that one of the reasons why we're facing so much unmet need is because we don't have a workforce to do the sorts of things that we need to do in terms of behavioral health and mental health and wellness. And in addition to having people, we need to make sure that those people are culturally and linguistically diverse to meet the needs of all Boston's residents. So with this funding, what we plan to do is to create a behavioral health workforce pipeline to fill significant gaps that I've mentioned. Again, we want to build a more diverse workforce that's both culturally and linguistically responsive. We'd like to invest in non-clinical training programs, clinical training support, placements in BPHC as well as in city departments, high school and college pipeline programs, and to also meet staff and administrative needs to run the program. Of note, we are already doing some of this work at the Commission, and that includes through BAHEC, the Boston Area Health Education Center, which is a youth pathway, as you all know, for health careers, working to raise the proportion of the youth from underserved populations who successfully pursue careers in health and health education. This funding will allow for us to build on successful programs like BAHEC. And of note, we are also working in close coordination with city departments, particularly the Office of Workforce Development. So in addition to pipeline and development and workforce building, we would like to ensure that the center is leading the way in terms of capacity building and training, particularly amongst our own workforce within the city and beyond. We know that employees are struggling with their own mental and behavioral health needs. Many of them are being confronted with behavioral needs of the public every day, whether they be folks who work in libraries, coaches on the field of our city parks, city council staffers, or really anyone interacting with city residents. Most people do not have the training, knowledge, or capacity to assist our residents with the support that they need. So with this funding, we plan to increase capacity and training for the commission and city workforce to enable city employees and community members working directly with Boston residents to better support them. And we also plan to provide staff development programs, training programs for the community, workforce resiliency programming, staffing, and administrative functions. Secondly, and lastly of the three initial priorities, I'll mention that we are very much so aware that stigma exists and is very intense around mental and behavioral health. It's pervasive, and resources are lacking to actually address that stigma. So with this funding, we plan to invest in communication campaigns, a website, and additional digital and multimedia tools to address the stigma related to mental health and behavioral health by acknowledging the needs experienced by many Boston residents, share coping skills, and connect residents to resources. I also want to add that this isn't just about digital, virtual, multimedia support. It really is about getting out there and doing the footwork, because the reality is that a lot of people don't access resources in that way. So we'll keep all of that in mind as we're thinking through how to best communicate with different populations. So I'd like to turn to our proposed investments in substance use disorder response. But before outlining our specific proposed investments, I think that it's important to touch base briefly on the scope of recovery services that BPHC currently provides. So our Recovery Services Office and our Bureau provide advocacy, prevention, and treatment for residents impacted by substance use disorder, specifically within the Bureau across 14 programs housed within 4 divisions. Direct services cover the broad continuum, including education, overdose prevention, and Narcan distribution, street outreach, daytime low-threshold spaces, drop-in access to care for treatment, transitional and long-term residential programming, outpatient services, youth substance use prevention, and a peer recovery program. So over the past year, we've placed over 1,800 people in substance use treatment programs. We provided residential substance use treatment to 432 individuals on our Mattapan campus. We've delivered opioid overdose prevention and response to over 5,000 individuals, distributed more than 26,000 doses of naloxone through our drug users health program, and removed over 1 million syringes from city streets and parks through the Community Syringe Redemption Program. Our programming has always met clients where they're at and have worked to engage people in services that are the best for them at the right time for them. I think that it's important to note that during the community engagement process in Let's Go Together, this is where this slide actually comes from, the needs related to individuals experiencing substance use disorder were highlighted, and that's why we're making many of the proposal requests that I'll review. So we recognize that we need to create a safer and cleaner neighborhood environment and increase service provision in areas across Boston. So in terms of what's happening in the Mass Avenue and Milnia-Cass area, what we plan to do now that the encampment has been removed is to continue our successful recovery services program with increased street outreach, harm reduction, referrals to treatment. We know that there's a lot of work that needs to be done in this area, and we certainly are looking forward to having additional funding to staff additional support to do the work that needs to be done. Much of this also means providing cleaning, enhanced transportation to services both in other neighborhoods and outside of Boston, and expanding services to address housing stability and security. We also plan to create the Recovery Services Coordinated Response, or SERV team, to provide citywide outreach consistent with the Encampment Liaison Protocol to be better able to respond to unsheltered individuals and to be able to respond to different geographic locations around the city. And then lastly, but certainly not least, we need to support additional community engagement around the city. It's not just about what's happening in the Mass Avenue and Milnia-Cass area. Certainly other communities are looking for engagement, want to be a part of this process, want to inform this process. So we are asking for funding to support additional community engagement to facilitate that. I also want to mention 2 additional programs that we're asking for funding for. One, to expand harm reduction outreach, and that essentially means to do a lot of the work that we're already doing with the AHOPE program, to do that in more places around the city, to meet people where they're at. And then lastly, and I would say this is incredibly important, the other things are also very important, but I think this is something that we are aware is a critical need, is looking for and adding additional engagement spaces. So these are places that would be drop-in sites, places where people can go to find services and to be welcomed and to explore options for them, whether it be harm reduction or if it's treatment, or to be placed on housing lists around the city. So it's not just located in one particular area, it may be in multiple areas around the city. So we are also asking for up to 3 sites, funding for up to 3 sites to establish these drop-in centers around the city. So I think this is my last slide. I just want to briefly touch base on other investments that, while not within our bucket, have a direct impact on long-term health, health equity, wellness within the city of Boston. Certainly Mayor Wu's overarching goal of making transformative investments, and hopefully the strategies and interventions that I mentioned are, you think they're categorized as such. We certainly do believe that that's the case. All of these are meant to set up a strong foundation for the city of Boston. And there are many other strategies that have been implemented by other folks that I think are very important, but they're also public health related. So Boston being the best biking city, the idea that that may be the possibility of being a more walkable city, the fare-free bus expansion, the electrification of the BPS bus fleet, all of these things are programs that we support within the Boston Public Health Commission, and we think that this is all going to work towards making Boston healthier and more equitable for our residents. So I welcome any questions that you have.
Great, thank you so much, Dr. Ojikutu. And I'll reserve my questions and go to colleagues. So we'll start with the Public Health Chair, Erin Murphy, and then it'll be Mejia, Fernandez Anderson, Braden, Flynn. Councilor Murphy, you have the floor.
Thank you for that. I have a few questions. On the health response to the ongoing substance use crisis, are we specifically going to support veterans with PTSD and mental health conditions? Do we have a plan specifically for that population?
So I'm going to turn to Jen Tracy if you'd like to comment, and then I can also comment.
Sure. I mean, there's no specific program around veterans PTSD response in our work, although we serve everyone that comes to our door. Veterans are one sense of population that we serve, yes.
Jen, can I ask you, and for both of you, can you guys try to speak into the mics?
Ooh,
only
sorry.
because basically everyone in the room can hear you, but then the people watching on TV can't always, so just from an accessibility perspective.
Yeah, because do see a need, and please, Jen, because I know you're an expert in this field, though, that a comprehensive women's shelter would be very helpful and important for our women, and also as the chair of veterans, and just knowing that they have specific needs, like our seniors do, right, and their mental needs. So is there a plan, or have you thought about targeting those 2 populations differently? And not, I know that you do support everyone that comes through the door, but putting specific funding specifically for those 2 groups.
Well, we're familiar with the housing, surges and the housing focus that Chief Dillon has done around veterans and housing, which has been really successful. I think this, may fall under sort of the new behavioral health center, because it is so, it's complex. So I would turn to you around the veterans piece, but.
So within this center, our hope is to address issues, mental and behavioral health, across the lifespan. I think we also turn to you all as city councilors to say, what are you hearing? What is it that we need to be doing? You also mentioned women, and I just wanted to comment that, Woods Mullen being, the shelter that it is, we did establish low threshold housing for women who are experiencing substance use disorder there, and we hope to continue that. That actually fell within the Mayor's Office of Housing, so Chief Dillon may have already spoken to that. But we welcome any thoughts that you have about expanding programming for women or across the age band or for veterans.
And on the programming topic, when I visited St. Francis recently, Karen spoke about how more women are coming to St. Francis. The first day the bus was available, she said 2 women came, and the day I was there were 44, so that was wonderful to hear. But is there a need, or do you think we should target more money specifically to that program or others across? Are there other shelters or programs in the city that we can help get women away from Mass and Cass area into places like St. Francis?
So what I'll chime in and say, again, Jen, if you want to add to that, I'll say that part of our transportation plan is shuttling or offering transportation to St. Francis, Boston Living Center, Women's Lunch Place, and Rosie's Place. So it really does provide options, I think, for women. I think that with some of these day spaces or the drop-in spaces that we're looking to fund, I can completely see that some of them would be appropriate for, you know, specific programming related to women, and I think that's a great idea. Certainly, this is an evolution. We're waiting for the RFP, the proposals that will come in, and we'll see which places, you know, want to do this. But we are very much so supportive of services geared specifically towards women.
And I know with the mental health, it's good to hear the focus there, and it's very connected to open spaces, parks, schools with, you know, sports programming, athletics. And do you have a partnership? I know that the Phoenix knows you well, but to continue the partnership there or other programs like that, is that in your plan that you're proposing?
Yeah, absolutely. I mean, the Phoenix is one partner, as you know, that we've worked with consecutively over the years. We actually brought them to Boston when they, you know, when they reached out, found a temporary space for them, and now they have this large space in the New Market Square area. But and have also done a lot with us around the housing folks and working on. We got a grant, a Rise Foundation grant to buy supplies and, you know, sheets and linens and everything like that. Phoenix House helped to organize that with the peer recovery centers across Boston to provide people with essential needs. So we'll continue to work with Phoenix, and we'll continue to build that partnership. But wellness and substance use and recovery is about physical wellness. It's also around the arts, music, and other ways that we can incorporate strength and recovery into people's lives. So, you know, we have several projects happening with all of that in mind. Thank you.
Yes, and lastly, the Long Island Bridge, if you could.
So in terms of Long Island, much of that planning is in the operations cabinet, and I think they have more detail as to the status of the actual bridge and capital projects related to Long Island. But what I would say is that Mayor Wu and, you know, the Boston Public Health Commission, I think we're committed to exploring every possible opportunity. We know that services are needed. We know that space is needed, whether that be Long Island or some other place around the city. I think everything is really on the table to meet these needs, and I think it's absolutely necessary as we look forward and figure out what we do with, you know, what's going to happen with the unsheltered population. I mean, they need services and they need housing.
Okay. And lastly, I will be leaving earlier. I have my first in-person physical in 3 years, so I will say before I please, everyone, make an appointment with your doctor and have a physical. So I'm sorry I won't be here for the whole meeting. I'm not leaving yet, but I will not be here for another round of questioning. So thank you.
Thank you so much.
Thank
And
you, Councilor Murphy.
Councilor Murphy, am I right in recalling that your doctor is at a community health center?
It is South Boston Health Center, yes. Always have, myself and my family have always gotten our health care at the health centers.
Thank you so much, Councilor
Thank you.
Murphy. Councilor Mejia.
I'm also a proud community health center person. I'm from Dorchester Community Health, and my whole entire family has gone through there, and my daughter now too, so generations. strong. So thank you so much. I'm really encouraged by all of the work that the commission has been doing. I just have a few questions. I'm excited to see some investments around workforce development. I think when we met, I talked a lot about that. And it seems like we are going to be pouring some resources to help employees too, right? So it's not just,
Absolutely.
so I'm happy to see that we're moving in that direction, because we can't be well and do well if we're not taking care of ourselves, and we can't show up for our folks if we're not taking care of ourselves. So I'm glad to see that. Can you, you talked about vaccination. I believe it's at 80% of Boston residents that you hope to be vaccinated by 2026. Was that?
Well, I would say I haven't necessarily put a goal out there necessarily. I think right now we're at around 74% fully vaccinated. That's not where we want to be, which is why we're continuing to move forward, particularly boots on the ground. I mean, to really talk to people about, vaccination. So.
Right. So with that, because there's been so many different surges and spikes with COVID, rates and all these new strains coming on to the scene, just curious about how you plan to navigate that.
So I think one of the strategies that I was hoping to emphasize is working very directly with community partners, community coalitions, and the community health centers. They know the catchment, the population that they're in best. And I think that one of the challenges that they've told us that they face is they just didn't have the funding to do as much work even beyond the population who would necessarily normally go through the door. So in engaging them and in providing them with more resources and thinking strategically with them about how we do partner better, then we can get out into the community and do more in terms of boosters, both first boosters and second boosters. And in particular, as I mentioned, getting our kids vaccinated, because I think there are many deficits and stark disparities that we've seen.
Yeah. And in regards to the new strains,
Yes.
could we talk a little bit about kind of like
Sure.
what that looks like?
Sure. So in terms of the variance of concern, I think one of the major issues to keep in mind is that what we're seeing right now is increased transmissibility, not necessarily increased severity of disease, which essentially means that we are seeing a lot of COVID, and that was part of the data that I showed you. In terms of hospitalizations, what we're still seeing are people who are either unvaccinated or they have some underlying reason that they're actually ended up having more severe disease and having to be hospitalized. We are, in my conversations with the hospitals, seeing less severe illness, fewer people who are in the ICU for COVID, and we're seeing more cases of people who are within our data who are incidentally diagnosed with COVID-19 as opposed to being admitted with COVID-19. So as we see these new variants, part of what we need to do as a commission is make sure that we're having enough people who are getting tested, getting PCR tested, so that we can actually know what's happening. I'm sorry if I'm not answering. Tell me.
No, you are. No, I think my nonverbals is because I'm getting nervous about the ringer.
time?
And I don't know how much time I have left, and I just have 2 more questions. Sorry, I just don't know how to.
It's okay.
You have 4 minutes, you're good.
Yeah, I'm working on how I show up in this world. So sorry, I'm just really trying to work on my face. So I was nervous about my time. But no, I'm glad that we're thinking about it. So
Yes,
I'm glad that you got a plan for it. So that's good. Thank you. I do have 2 more questions that I just really wanted to make sure that we talk a little bit about. I'm sure you're familiar with the Youth Development Network.
Yes, I am.
And that's under the Boston Public Health Commission.
It is, yes.
Yeah. And so I'm just curious about, because that's a group that I've worked with on a volunteer basis and also through the organization that I founded many years ago, every summer. And they work with young people who are chronically absent. And what we've been hearing is that a lot of our young people, it's hard to get them back into school. COVID has really impacted attendance. And I'm just curious, what, if any, financial investments are we thinking about in terms of just identifying students who are chronically absent, not through the Boston Public School budget, but through the Youth Development Network, right? That's a very specific line item that falls under your jurisdiction, and there are a lot of young people dealing with mental health and wellness issues, as well as the impact that COVID has had on the entire family unit. So some young people have had to take on 2 to 3 jobs just to help support their families. So there's some real issues that you may not think fall into public health, but they do.
Yes.
And so I'm just curious about what you're thinking about in terms of funding to support the Youth Development Network and increasing their capacity, because I also have learned that they are struggling to hire people because of the rates of pay. So just curious about how we can use some of this particular emergency one-time funding to support the Youth Development Network, at least get some of these kids back into school and supporting them.
That's an incredibly important question, Councilor Mejia, and I think the Youth Development Program is, the Youth Development Network is a really important program for all the reasons that you mentioned. The issue of, I'll start with staffing. Staffing, recruitment, and retention has been a challenge across the commission and across city departments, as you probably are aware of. We are trying to approach these issues holistically across the commission, and we're working on issues related to increasing compensation, staff appreciation, staff wellness, all of these important critical areas. Because, you know, if you just look across the commission, we have a lot of positions that are currently open, you know, because of these issues. And specifically related to the Youth Development Network, certainly, though we're thinking holistically, we are paying attention to the needs within this critical program.
Right, so this is what I just want to, just because I know that my ringer is going to go off, I just really want us to spend a little bit of time on the Youth Development Network, because they have a position available at Brighton, and they haven't been able to fill it, Brighton High School.
Okay.
And I only know, not that I'm not calling you out, Councilor Breeden, I'm just naming it because I know that's your neck of the woods, and I just want to elevate that. Okay, and they have identified, and I only know this because of my intimate work with this particular network, not because they happen to be in Brighton. They also have a site at the Burke, and they also have Charlestown, so they're across a number of different high schools. But they have had a challenge in filling their position at Brighton, and I met recently with a teacher who expressed a lot of case management needs that she can't fill, which is what the role of the Youth Development Network would be, is to connect these young people into these services. So I want to go back to how can we utilize some of the funding, this one-time funding, even if it's not going to be sustainable forever, but at least to address the immediate concern that the Youth Development Network is having in supporting our students who are chronically absent and not going to school because they're still dealing with the impact of COVID. I just really want us to consider that as an investment that you would be willing to make and to consider making with this particular hearing that I'm in right now.
So I'm happy to consider that as a potential funding, a use of funding. I think, as you're mentioning, it's a very critical issue. And I think, again, that a lot of what we're facing is that our salaries aren't necessarily competitive, and we need to work on that. I mean, I actually am looking at the salaries within the Youth Development Network, so I'm looking at it.
It's ridiculous.
It's something that from day one, when I started this job, I said we have to have a workplace improvement program. And number one on that list of workplace improvement program agenda items, compensation. So we have been looking at incentives, bonuses, how are we going to get a COLA, and certainly within the Youth Development Network, I see that, you know, the salaries are
That's why people have to take on 2 to 3 jobs just to be able to work for you guys, right? And but I'm not going to harp on that issue.
Yeah.
I will just say, because I'll wait for my second round of questions because I want to go back. I will say and stress again that when I think about the one-time investments and I think about what this is supposed to be for, it's supposed to be for COVID and, you know, COVID relief and like, you know, recovery, blah, blah, blah. So if that's the case, the Youth Development Network is dealing with a lot of challenges that young people are experiencing as a result of COVID, so much so that they're not going back to school. And I think that we have an opportunity and a responsibility to think financially how we can support the Youth Development Network with these funds.
No, I appreciate that. Yes, we'll be looking at that.
I will be too.
Thank you. Thank you, Councilor Mejia. And Dr. Ojo, if I can ask you to just adjust your mic so that it's
Again, I
closer to you,
apologize.
that'd be great. Thank you. Councilor Fernandez-Henderson.
Thank you, Madam Chair. I guess my questions are similar to my colleagues in terms of building capacity, and I'm really concerned about especially behavioral health I read the packet once again because I had to really try to understand the how. And in terms of behavioral health and training, I guess already existing staff, your program that you are trying to implement in schools and collaborate with community to build capacity. I'm not clear on the how. Can you expand?
So specifically in terms of building workforce capacity?
For behavioral health.
Yes, okay. So I think that there are a number of different strategies that we will try to implement. And again, a lot of this is currently being, discussed and developed. And so any thoughts about this would be welcomed. What we would like to do is to enhance and create stronger partnerships with some of our schools, whether they be high schools, the technical schools, whatever it is, and look at those partnerships and make them such that there are clear opportunities, desirable opportunities for people to go into once if it's a community college, whatever it is, that they can go into these opportunities and then build capacity and have a job at the end of the day. But this is going to take a lot of partnership. In our discussions with some of the hospitals, community health centers, some of the other centers for mental health around the city, mental and behavioral health around the city, they are looking for this type of partnership. They would like to have more people who could work in different capacities across sort of the spectrum of things that people do in terms of behavioral and mental health. But they don't see these pipeline programs. They don't see necessarily programs like BAHEC specifically for behavioral and mental health. So that's one strategy. I think secondarily, another strategy goes towards this issue of compensation and pay and why people don't necessarily go into those particular jobs. Now, while we're dealing with this holistically within the commission, I think our focus is going to need to be how do we make these positions more desirable for people? And that's going to take a lot of discussions. An external advisory committee will be established. We would love to talk to you more about what you're hearing, thinking about how to do this. So I don't think there's one strategy yet. I think the how, some of the things I think we can get started on right away. Some of this is going to take some planning, particularly as we try to reach diverse populations and overcome the issues of stigma and why people may not be going into some of these jobs.
That goes into two questions that I have in terms of issues of stigma and as well as ensure that the responses are equitable. How exactly will you measure, in particularly when you look at COVID recovery or just ARPA funds, we know that this fund is supposed to be for a certain population or to prioritize a certain population. And so this needs to be racially equitable. And so I want to understand, and I definitely am not a proponent of saying something is going to be equitable with good intentions and implementation, but then not have metrics in place to do that because we've learned from those mistakes. So what dashboards do you have already implemented to actually, and what calculations do you actually have in place or metrics to ensure that it is racially equitable?
So we collect a number of different data elements in terms of measuring equity. Certainly we look at race and ethnicity in a broad sense to determine who's getting access to services, and I'll provide an example. We also think about what neighborhoods people are coming from. It's not just race and ethnicity, it's actually who folks are. We are working on strategies to understand nativity better, to understand what countries are countries of origin of individuals, so we know who are the people who are actually accessing the services. That has been a little bit more of a challenge, but it's certainly something I'm very interested in promoting and pushing forward, so it's certainly something that we're looking at. Let me just give actually 2 examples. So going back to our housing surge program, where we, offered people housing in these 6 different sites back on January 12th. The first step of that process was data collection. We were very intentional, and as you said, I think it's incredibly important to know what you're doing before you do it, and actually have a plan in place and course correcting, if you don't see what should be happening. So we went out on the street with tablets, went to each tent to find out who was in there, race, ethnicity, re-entry, veteran status, what housing plan they already had, what substances they were using. Did they have a mental health provider? Did they have a doctor? And we provided that information we disseminated the best that we could widely. And there's actually a dashboard available to say where people went. So in other words, to know were there differences, statistically significant differences between individuals, whether it be women, men, partners, people of, racial, ethnic differences in who got access to what, congregate setting versus actually a hotel, so on and so forth. And we haven't found significant differences, but along the way, each week we were looking at reports to see, what's actually happening to people within these settings. Are some settings...
I like that you had a plan and you knew what you were doing beforehand. You could monitor it and actually course correct it as you go. How does that compare, or how does that comparable for specifically racial equity as it relates to ARPA funds? Because it's a different
Absolutely.
priority.
Well, some of the ARPA funds will be used for the same the public health response to addiction. So we're going to be doing the same things in terms of data collection, being intentional, knowing who's getting what. And that has been our process in terms of vaccination as well as testing, to know who's getting tested, what neighborhoods are not getting tested. And one of the reasons, just going back to ARPA funds specifically, that we wanted to enhance our ability to do wastewater surveillance so that we know where there is more COVID, is because we know by neighborhood, certain people aren't accessing testing. So we're not getting the case rate, we're not getting accurate community positivity. But if we know that certain neighborhoods clearly, and we can't get that data yet now, but once we have the funding, we can know, oh look, there's a hot spot there. We need to push more services into that area. We need to push more health communication into that area. So I think that everything we put forth has metrics, outcomes, and equity focus. And we are being, I believe, intentional along the way in how we are designing our programs and how we will adjust them if they become inequitable.
This is all publicized and popularized in real time so that we're building transparency with community. I can access this on a website.
So once we get the funding for like the wastewater, just that specific example. Well, just other
COVID.
things.
ARPA funds,
ARPA funds.
behavioral health, stuff that's going to be
Absolutely.
spent on.
So the Mass and Cast dashboard is actually live now, so you can actually see who went where. You can actually, I believe that we were trying to build in the issues of race and ethnicity. I will look at that and get back to you to see if that is updated or how often it's updated. But our intention is to be as transparent as possible. The point of having dashboards is so that anybody can look and analyze the data themselves. Otherwise, we're not going to be equitable, right? Because there are going to be people who are going to know, and some people are not.
The dashboard will exist as it relates to this?
Yes, we're going to continue to populate for the public health response to substance use. That dashboard will continue to be populated so that you'll be able to see data as to where people are going, who had access to medication for opioid use disorder, who has access to a physician, who's been lost to follow-up, deaths, unfortunately. I mean, all of this is really important for the public to know with these dollars.
Sorry, and the other part of the question was in terms of communicating stigma. In particularly to quote, I guess it was, you mentioned communicating it as it impacted. I can't find my sentence that I'm trying to rush here. You talked about behavioral health communication, address stigma of mental health, behavioral health by acknowledging the needs. This was in a packet.
So I think what I was saying there, what we're saying is that different communities understand mental and behavioral health in different ways. I think, first of all, acknowledge that. Everybody's not going to take the same message, internalize it in the same way, and then go and run and access a therapist. Acknowledging that people are coming from different places, you have to meet them where they're at, you have to provide them with the services they want to access, not the services that you think they may want to access. I think that acknowledgement is a really important part of the process. My thought about these communication campaigns, and certainly will, contract with, specialists in this area, is that they have to be, involved with, they have to be led by communities. There has to be a significant community engagement process, because what we think may be undesirable to a certain group of individuals may not be. It may be that we're thinking completely differently than what we're thinking, but we never ask.
Treat people the way they want to be treated, not the way you want to be treated.
Exactly. There's no other way to do this.
But what's the how? How do we do that?
Well, I think
Or what's the plan?
So the plan for the communication campaigns is similar to what we've done with other communication campaigns. It's really going to people, meeting them, in places where they want to talk, in ways they want to talk, and having a very intentional and intense process. It's going to take some time to get this done. Understanding what they want to see in terms of mental and behavioral health, and their understanding of mental and behavioral health. And then it's going to be working with specialists who actually understand those communities to craft appropriate messages, materials, strategies that meet the needs of a very diverse community. And that's why we need a significant amount of funding to do this, because we have such a diverse population in Boston.
Logistically, I think having a breakdown of what that is, amount of staff, resources, all the materials, like what are you creating, what does that look like? I think logistically, because then you would know the need. If you have the numbers, then you know logistically what you need. And I think having that plan for us helps to say, yeah, they have a really good idea of how to execute this thing.
I appreciate that, and I think that we can provide you with that plan. We've done thus far, without knowing that we were going to have the funding necessarily, we've done a landscape analysis, so an understanding of what programs are out there, at least within the commission where there's a lot of mental health programming. We have hired our chief behavioral health officer. We are looking at programming across the city so that we actually understand what the challenges are, what the capacity needs are, because it may be that there are great programs out there, but they just don't have the capacity to scale up. And if they had the capacity, we'd be meeting the needs. So we have to understand that before we start to implement anything. So I'm happy to provide more details and certainly keep you very closely involved as things evolve.
Thank you, Madam Chair. I'm not sure I really...
Thank
so
you,
capacity meeting the need.
Councilor Fernandez-Henderson.
Sorry, last point. Capacity meeting the need, but then is it because of can't build capacity, but also because we don't have the right people? There's like a lot there, a lot of nuance. So thank you, Madam Chair.
Thank you so much, Councilor Fernandez-Henderson. Councilor Braden, and then Councilor Flynn.
Hi.
List. Okay, a few questions. You mentioned, I think our community health centers, I think many of us here, all of us probably get our health care through community health centers. And one of the things that has happened with COVID is that there's lots of deferred care, and I think they are experiencing the same recruitment problems as everyone else. But they're also trying to catch up with all their deferred care for diabetes care, and then all the well child immunizations, etc. Do you think that this additional funding will help take a serious bite into that? Because I have no idea, just in terms of the scale of the problem. I know there's a problem, but I just don't have a good handle on the scale and how much of a backlog, because I know a lot of people rely on community health centers for their care in Boston.
So I think that's a really good question. We've been engaged in a number of conversations with the community health center leadership, both their presidents and CEOs and their chief medical officers, operations teams, to get a sense of what they believe their needs are. And one of the most important things that they've mentioned is that, you know, we need to have some discretionary funding so that we can incentivize staff. We need to be able to have programming that will do exactly what you said, bring people back into care. We need staffing. And even if we have a funding line for staff, we need to be able to, you know, incentivize more. We need to give people bonuses. So in terms of the actual amount that's going to be needed across the health centers, well, as you're well aware, some community health centers are more capacitated in terms of funding than others.
Yeah.
And we've noticed, as you look at what we funded folks for over time, there are certain community health centers that we know need more than others. And we're gonna have to figure that out.
Yeah.
You know, what we'll do is we'll put out, you know, an RFP, make it as brief as possible so that people can easily respond, and they'll tell us what they need. And we were asking for $3 million for this navigation process, but the other buckets of funding in vaccination and testing, maybe that also is used in that, to do that extra bit. It's not gonna fund everything, but it's certainly, I think,
yeah.
at least what we've heard is that it's gonna help.
Yeah, and you can incentivize staffing.
Exactly.
And bonuses and whatever else. Let's see. In terms of, you know, the COVID pandemic exacerbated many mental health and behavioral health problems. Do you have any good sense of our capacity in terms of substance use treatment and rehab spaces in the city? Like, have we increased that capacity in response to this challenge, or are we? And I mean, I'm not talking about. I'm just talking about more. Even dividing it into separate buckets, like people, elders, for example, or different programming that's specific, not necessarily our homeless population with substance use challenges. Because I know there's a sort of an iceberg effect. The people we see are maybe the more visible folks out on the street and in pretty dire circumstances, but then there's a whole population of people below the waterline that we're maybe not even aware of.
Sure. So there's a broad continuum of services across the city that our community providers provide. I have not seen a lot of physical growth in beds, treatment beds, detox, or residential within that system. Those very same providers are also struggling with workforce issues and recruitment and retention as well. A lot of those current programs that serve most of them 18 and over. Some programs that are serving women, some programs that are serving women and their children, like ours in Mattapan and the one at St. Mary's in Dorchester, serve different populations, but are struggling sort of with the workforce issue as well as, and also COVID outbreaks within programs. Mm-hmm. So programs have had to set aside beds to isolate folks, as well as provide the same kind of COVID restrictions and everything like that everyone else has too. What I would say is some of the ARPA money specifically, just to kind of bring it back to the dollars that we're targeting here, is one of our goals is to work with communities to identify for them to identify the needs within the community. For example, the engagement teams, community engagement teams that we're looking to expand to 3 different neighborhoods this coming year, is really an effort for a community to identify what their challenge is. So that may be people on the street, or that may be, maybe the elders in the the older adults within a community, or young people, as
especially young people as well. Yeah.
So that's one example of that.
It has kicked up a lot of problems. Let's see. I really, I think every hearing we've had with all departments across the city, the workforce pipeline, the workforce development plan is critical, and I'm really glad to see that you folks are also putting some thought into that. How do we, in terms of the pipeline, work with partnerships? We've got all these academic medical centres and university programs for professionals of all ilks. Are we working with those institutions in our city to try and capitalise on some of that know-how as well?
So absolutely, I don't know if this is not.
You need to give it a minute.
You just wait. It's,
There you go.
Okay. Is it okay?
it's
Okay.
a beg button, so you don't have the ability, no one controls it at the desk. Only the people back there control it.
Oh,
Just
I
an
see.
illusion.
And so,
Okay,
so when
I
you,
thought
so
it was
that's
me.
so when you push it, it's just saying you want, because it would be madness if counselors
I
could
see.
all activate them at the same time during meetings.
I see.
So that's what's going on. Anyways, I won't deduct that from your time, Madam Chair. Councilor Braden, go ahead.
So I think that what you're saying is a critical piece to developing this pipeline. We have been in discussions with, clinical partners, hospitals, the CHCs, about what their needs are, and it's overwhelmingly that they need a workforce and a strong workforce. So basically they're saying that there are jobs out there, they need people to be trained, they need people to be interested in this type of work, particularly in behavioral and mental health. So part of the work that we want to do in this center is really think strategically with them, bring them to the table. There will be an external advisory committee, and say, how do we get people interested? Do we use programs like BAHEC and expand? Do we try something else? We have to think about compensation and how we can incentivize people to stay in Boston, because we have a problem with training folks, and then people leave. And the point of this funding is that we want to keep people here so they can serve the needs of Boston residents. So a lot of this is in evolution. I would love to have the opportunity to talk to you about it more and the things that you're hearing, because I do think that that's really key to the strategy.
Yeah, I agree. Yeah, thank you for all your work, and I think I don't have any further questions at this moment. Thank you, Madam Chair. Thank you.
Great.
And I look forward, some other time, I'd love to sit down.
Absolutely.
Yeah.
Thank you so much, Councilor Braden. And we're going to Councilor Flynn next, and then before we do my questions, I'm going to go to the folks in public testimony who were here from the start, just because I know we've got a couple of doctors who have 4 o'clocks that they need to do, and we've got some folks from the community health center. So, and so if you are in the Zoom, just know that after Councilor Flynn, we'll be going to you. Councilor Flynn, you have the floor.
Thank you, Madam Chair, and thank you to Dr. Ojakutu. Thank you to Tim and to Jen as well for the important work you're doing in the city. Madam Chair, during the pandemic, I did a lot of work, like my colleagues at various community health centers across my district, across the city really, including South Cove, including the South Boston Community Health Center, East Boston Health Center, South End Health Center, which is now merged with East Boston. But I know that the South Boston Community Health Center played a critical role during the pandemic, and had an opportunity to work with the medical team at the hospital, at the health center, helping seniors get appointments for vaccinations and other services as well. And the reason I'm bringing this up is this is one of the areas where I'm seeking assistance from the federal government for the health center. They are expanding. One lesson that the health center learned during the pandemic is the isolation is to separate in the isolation to prevent the spread of respiratory and airborne viruses that we have seen throughout Boston. Certainly social distancing requirements were critical, but we also discovered that we were experiencing at the health center space shortage. At the same time, behavioral health department experienced an explosion in demand for its services, just like every other health center across the city. But what I wanted to focus on is the clientele at the health center. Many of the residents are from the various public housing developments including Mary Ellen McCormick, West Broadway, and Old Colony. I think combined, that's the biggest public housing area in the city. Most of the residents, most of the patients, tenants, are communities of color, many Somalians, many African-American, Latinx residents, immigrants. And I bring this up because this is an inclusive health center, just like all of them are. So they are expanding. While some of that demand can be met through telehealth capacity, that has also seen a large increase during this time, we have a severe space shortage at this health center. But South Boston Community Health Center is proposing to build a 2-story addition to its existing facility. The addition will add 11,000 square feet and provide 2 additional floors for clinical space, 1,500 square feet for clinical space will be created by renovating the existing administration space for the 3rd floor as well. One area that I worked with them on is food access. They saw a huge demand in food access assistance during this period of time. The South Boston Community Health Center has completed a study and is proceeding to the design and development phase. It's critical for me to support this. It'll have a major impact in supporting residents, especially residents in public housing development. The current estimated cost for all of this, it seems like it's around $8.2 million. So one of the requests I've been trying to work on in terms of federal funding is supporting the South Boston Community Health Center. And the timing of it, I know the architectural selection is ongoing. The design phase is 6 to 8 months, commencing July 1st. The bidding and permitting process would start in several months. So I just wanted to put that on the record, Madam Chair, and also to thank the Boston Public Health Commission team that's here for their important work that they've been doing during this pandemic. I've had an opportunity to work with many people, many professionals on your team, Dr. Ojukutu, over the years, and worked closely with Jen on the situation in Mass and Cass for the last several years as well. So maybe I'll go to a quick question or a quick comment. And this is a subject that I've been focused on for 5 years. I know the Boston Public Health Commission puts out a report every year, and it's a report I always look forward to reading. And during the pandemic, I know we haven't. One of the challenges we've had is in terms of separating or doing more research in terms of the Asian community of Boston. For example, the area in Chinatown where we do public health assessments, at times that area or that group is categorized with the entire residents of the downtown Boston area. So I don't have an accurate description of the public health assessment in Chinatown at times. And that's something we have talked about, Doctor. Also, the public health assessment of various Asian communities is significant, is different, such as the Vietnamese community in Dorchester compared to the Chinese community in downtown Boston or the South End. But I just wanted to ask, with the availability of funding, are we able to dig deep and do more research into the Asian community throughout Boston and specifically target the research and demographics so we have an accurate reflection of the public health of Asian community in Boston?
So thank you, Councilor Flynn. Data analytics, data dissemination are core to what we do. And I'm very much so focused in on understanding diversity and really getting to a nuanced and granular understanding who people are, what their needs are. So as we work, as we've discussed before, as we work to reorganize some of our systems, one of the things that we are doing is developing a health equity dashboard that will essentially do what the previous, hard copy was doing, except that you'll be able to actually sort through the data yourself. Communities will be able to sort through it themselves, and they'll understand what's happening. This issue of data disaggregation by country of origin, by nativity, I think is one that I've discussed with our research evaluation office. We've discussed it in many different ways with the state because we get a lot of our data from the state, and we've been thinking about this in detail as we plan for the Boston Health Equity Measure Set, or BHEMS project, and it's certainly something that we hope to do. I think that there are challenges, as we've discussed before, but it's not impossible, and it's certainly, it's worth all the effort, because we're missing a lot in calling people Asian and not saying anything else about them, calling people Black, calling people Latinx, and not digging deeper into who they actually are. So it's definitely high on our priority list.
Thank you, Dr. Ojukutu. I appreciate that response and your cooperation. And I just want to highlight one quick stat, if I may, Madam Chair, just for the record, is, the Chinese community in Chinatown, that neighborhood is located literally on top of the Mass Pike, on top of 93, down the road a little bit from South Station, train station, South Station, bus station, where the trains and buses are always running. It's always the truck route also from Maine, basically down to Florida. Josiah Quincy School, as you know, is right there on the highway, right off the highway. And I say that because that ethnic group, the Chinese community, has the highest asthma rate of any ethnic group in Massachusetts, and a lot of it is impacted by the physical location of it, but also the environment. So I compare that to other Asian communities throughout Boston, but I reference that because of the important role public health plays in our communities. But I'd like to continue to work with you, Doctor, to make sure we have the best and accurate information on public health data, and I know your office is committed to doing that, so appreciate all your hard work and professionalism as well.
Thank you, Councilor Flynn.
Thank you.
My time is up, isn't it?
Yes. Thank you, Councilor Flynn.
Thank you, Madam Chair.
All right, so we're going to go down to public testimony. I'm just going to read the folks I have, and that's who we're going to do. And if anybody else signs up for public testimony, we'll do that at the end. So we've got Liz Brown from the Charles River Community Health Center, Dr. Simone Ellis, from the Chief Medical Officer from the Harvard Street Health Center, Dr. Denise de las Nueces from the Boston Healthcare for the Homeless Program, Barry Bach, the CEO of the Boston Healthcare for the Homeless Program, Sandra McCroom from Children's Services of Roxbury, the CEO, Julie Burns from RISE, and Marianne Frangulis from MORE. So that's who we will take right now. And if we can pull up Liz, first of all, I just encourage folks, I know I said your name and affiliation, but if you can just repeat that for the record, and then try to keep it to like 3 minutes. I know everybody who's about to be testifying has a wealth of knowledge, but just so we get everybody who needs to get in before 4 in, that would be fantastic. So yeah, 3, 4 minutes would be max. Can we get Liz up?
Can everyone see me?
Wait 1 second, we need to get the presentation down so that we can see, so that the counselors can see. There we go.
All right. Are all set on your end?
Yes, get going.
Okay, great. Thank you. Thank you, Chair Bach and Councilor Radin and the other members of the City Council. As Chair Bach just said, my name is Liz Brown, and I'm the CEO at Charles River Community Health. We are located in Alston, Brighton, and Waltham, and we serve nearly 15,000 patients a year who are the most underserved in our community. 53% are insured by Mass Health or other public insurance, 97% are low income, 72% need services in a language other than English, and 83% identify as being from communities of color. Many of our patients are recent immigrants and need many clinical services as well as non-clinical assistance to address social determinants of health needs, such as food and housing insecurity and other needs. As you know, there are 21 community health centers located throughout the city of Boston. In 2020, Boston Health Centers saw over 432,000 patients, reflecting the vibrant diversity of the city as a whole. 64% of our patients identify as a racial or ethnic minority, 83% are low income, and 3% are homeless. Health centers see patients of all ages, from infants to the elderly. By hiring locally and maintaining a board that is comprised of a majority of patients, each health center is highly attuned to the unique strengths and needs of its community. And I very much appreciate that everyone in the audience knows that, and I was delighted to hear how excited you all are to be patients of health centers, so thank you. Boston Health Centers, in partnership with the city and the Boston Public Health Commission, have worked tirelessly on the front lines of the pandemic to combat COVID through testing, treatment, contact tracing, respiratory clinics, vaccination outreach, education and administration, and now life-saving antiviral therapeutics, as well as pediatric vaccinations. Our health centers continue to be national leaders, vaccinating racial and ethnic minorities in the hardest hit communities. We appreciate the proposed funding for continuation of COVID vaccination and testing as health centers flex services in alignment with surges as they arise. We also appreciate the mayor's proposed ARPA allocation of $38 million for the Boston Public Health Commission. In particular, we are grateful for the community health center specific COVID recovery funding. As you know, our patients are more likely to either die from COVID or feel its lasting impacts. And this funding will continue to ensure an equitable response to the ongoing pandemic. And as was raised earlier, in addition to continuing our pandemic response, health centers have also been encouraging patients to return for both preventive care as well as chronic care, whether that be medical, dental, behavioral health, or vision care. And so the recovery funding is also really important to ensure access to care. For example, at Charles River, we've been calling our diabetic patients back to get their lab work done, their eye exams done, and other on-site services to get back on track managing their chronic condition. And we've also been focusing on getting our children in for well child exams as well as immunizations. Funding and support is needed to ensure this deferred care need can be addressed by community health centers. And I would just quickly note that the deferred care need is really unprecedented at this time, given the unprecedented impact of the pandemic on primary care. So I would quickly wrap up by saying, finally, we're also looking forward to the creation of the Center for Behavioral Health and Wellness and emphasis on the new behavioral health workforce pipeline and development program. The pandemic has demonstrated the nimbleness, commitment, and flexibility of our heroic healthcare workforce, and also laid bare the challenges for health centers to recruit and retain a workforce that can meet the unprecedented demand for care, especially behavioral health services, as we know the massive need for mental health care coming out of the pandemic. And the pandemic has also shown the importance of creating stronger behavioral health workforce pipeline programs that increase economic opportunity for underrepresented groups and also allow our patients of color to receive care from providers and staff who share their racial and or ethnic background and can provide the culturally and linguistically sensitive care that our patients need. Thank you for the opportunity to provide this testimony.
Thank you so much, Liz. And next up, Dr. Simone Ellis, and then it'll be Dr. Denise de las Nueces. So, Dr. Simone Ellis?
Thank you. Good afternoon, Chair, Councilor, and members of the City Council. My name is Dr. Simone Ellis. I'm the Medical Director at Harvard Street Neighborhood Health Center. We are located on a very busy Blue Hill Avenue corridor in Dorchester. We're honored to serve our local community, who is largely comprised of underrepresented minorities. We have patients who have been with us for 40 years, and some who choose us as their medical home as new residents to this country. Our patients face many challenges, as they are oftentimes under-resourced, working low-income jobs, state-insured or underinsured, often facing issues of food insecurity, unstable housing, and limited transportation. They also deal with the psychological stress of structural racism and cultural bias. In addition, many of our patients are best served in a language other than English. I'm proud to say that our staff, from the front desk to our leadership team, is representative of our community, and many staff members speak at least 2 languages. While I'm new to my role at Harvard Street, as a physician, I know that the last 2 years have been quite challenging for all of us providing medical services during this pandemic. We have had to find ways to adapt and be innovative in our outreach efforts. From the beginning of this pandemic, Harvard Street pushed forward with a very quick and robust response to COVID-19. We're very grateful for the partnership with the City of Boston and the Boston Health Public Commission that has allowed us to make sure that we can provide testing and vaccination to all of our patients, in addition to those that are hardest to reach. Through this partnership, we were able to partner with Prince Hall and administer nearly 20,000 vaccinations and 15,000 tests, where our patients were able to walk to these testing sites and vaccination sites. We're very appreciative of the mayor's $38 million American Rescue Plan budget proposal for the Boston Public Health Commission and the specific community health center funding that will help our COVID recovery and response efforts. So we know that it's going to take some time as a medical community to confront the aftermath of COVID. Right now, we are in a danger zone, and we mentioned this before earlier in the hearing. Due to COVID, many patients have delayed their primary care needs, they've delayed their cancer screenings, and we have delays in access to mental health services as well. In addition, COVID has uncovered the degree of health inequities that plague our medical system, and this funding can help us re-engage and treat the influx of patients that are looking to access our services that we provide. I'm happy to see that the investments in the mayor's budget proposal that are specifically aimed to strengthen behavioral health workforce pipelines. Behavioral health, we need to recruit these providers and retain these providers as well. Our community health centers serve as a part of our health safety net. This proposal will help us continue to diversify our workforce and improve access to high-quality behavioral health care and expand our reach with delivering our primary care services. I appreciate your time today. Thank you.
Great, thank you so much. Next up is Dr. Denise de las Nueces. And then I'm just going to make one quick order adjustment. I want to make sure that Sandra McCroom gets a chance to get in before Councilor Fernandez-Anderson has to step out. So she's going to go after Dr. de las Nueces, and then I'll go to you, Mr. Bach. Forgive me for reordering. But Denise, you have the floor.
Thank you very much. Good afternoon, Councilor Bach, Councilor Baker, and members of the City Council. I actually will be testifying today on behalf of Boston Healthcare for the Homeless Program and in place of our CEO, Barry Bach. My name is Dr. Denise de las Nueces, and I'm the Chief Medical Officer here at Boston Healthcare for the Homeless Program in Boston's South End and at more than 30 satellite sites throughout the city. Our program is a federally qualified healthcare for the homeless program that provides multidisciplinary medical and behavioral health care, addiction, medicine, and case management services to more than 10,000 individuals experiencing homelessness every year, approximately half of whom are individuals who identify as BIPOC. About 50% of our patients have a diagnosis of substance use disorders, and 56% carry a diagnosis of severe mental illness. Like our fellow CHCs on the front lines and our dedicated partner, the Boston Public Health Commission, our program has invested deeply in meeting the evolving needs of our patients. As encampments started to emerge on Mass and Cass several years ago, we deployed a total of 17 FTE of multidisciplinary and multilingual staff to provide needed medical and addiction services in and around the area, alongside dedicated staff from the Commission. Throughout the pandemic, we have worked collaboratively with the Commission and other partners throughout the city and state to provide COVID testing and isolation resources for individuals experiencing homelessness, and have operated more than 700 isolation beds since the start of the pandemic. Today, in fact, we operate the only currently available alternative care COVID isolation site for individuals experiencing homelessness in the state. We are grateful to Mayor Wu's $38 million ARPA budget proposal for the Boston Public Health Commission, and specifically the Community Health Center funding. The mayor's proposal also includes $6 million for addiction services, which includes funding for the ongoing medical and behavioral health supports through the Boston Public Health Commission, with whom we have partnered closely throughout our program's history. This funding will support the continued recovery services and encampment response services that were supported by previous ARPA investments. This support is invaluable to our work and would help catalyze transformative innovation with a focus on equity, and we believe that the Commission would be responsible stewards of this funding. There is much work to be done, and we are fully committed to our patients and to the community. Thank you for the opportunity to provide this testimony, and again, our CEO, Barry Bach, will not be testifying today. Thank you.
Got it. Thank you so much, and thank you, Doctor. All right, next up is Sandra McCroom from Children's Services of Roxbury, the CEO. And then after Sandra, I'll just let Councilor Fernandez-Henderson make a brief statement about the docket I mentioned earlier that we're going to have a future hearing on. And then we'll be back to you, Julie and Marianne. So, Sandra, you have the floor.
Thank you so much. My name is Sandra McCroom, and I am the President and CEO of Children's Services of Roxbury. And I like to say first again to Chairman Bach and also Councilwoman Fernandez-Anderson for all of your time and support today. I appreciated hearing from Dr. Ojikutu as we have partnered with them. And today I'm here to talk about and request ARPA funding to support Children's Services of Roxbury to provide holistic wraparound health services to disenfranchised populations in Boston. Children's Services of Roxbury is 50 years old, so for 5 decades, we are the largest Black-led nonprofit in Massachusetts. We employ 400 plus members of the Boston community. We're in 4 cities across the Commonwealth. And what I'd like to talk about today is the institutional history and the ecosystem that we have created throughout Boston is a hidden gem. And I say we're a hidden gem is because a lot of people know CSR. We are well known, but not known well. We offer a comprehensive list of programs that most people don't understand or know about because we have kept our head down. We have developed relationships and partnerships. We serve 6,000 families across the Commonwealth every year. And we also run the largest behavioral health, Black-led behavioral health clinic in the city, certainly. So a lot of things that Dr. Ojikutu spoke about today, we look forward to partnering with her on that. A significant thing that we've done to put a stake in the ground is we were fortunate enough to purchase the building that we now own on Dudley Street. It is an entire block of Dudley, just up from the Kroc Center, about a mile up from Nubian Square, a little less than a mile from Nubian Square. And it is significant because generations of people have come here for behavioral health. We do foster care and adoption. We partner with so many agencies, and including fellow members on the panel. And in July, we're also going to be opening a young adult access center in partnership with DMH. We run youth development programs. And after the purchase of this building, we are working to rehab the building to make it much more family friendly so that we can expand our behavioral health services throughout the city. And really appreciate your time today. I, again, just want to stress that a lot of the services that we provide, some individual departments, whether it's state departments or individual departments in the city, know us for that department and may not have a full appreciation of the depth and wealth of expertise that our staff have, the longevity of the agency, spending 5 decades to develop a web of contacts and supportive services to provide these wraparound services throughout the Commonwealth. And we are asking that the council and the mayor use some of this $350 million, which is a staggering amount of money and yet still feels like not enough, to support our efforts to rehab our building that will allow us to provide more and better services. We expect to be able to expand and level up our services by 25%, both in terms of the number of employees we can employ and the number of children and families that we serve. We serve the most traumatized families and yet the most resilient families, and we want to continue to partner first and foremost with our families to continue to provide quality, culturally congruent services that they deserve in a building and a healthy workspace that they deserve. So again, providing and supporting our petition to request ARPA funding in the amount of $1 million seems like a very small ask given the amount of work that CSR can provide in supporting all the efforts around the city and be an anchor for those families who depend on us so deeply. So thank you so much for your time and attention, and we look forward to partnering with you.
Great, thank you so much, Sandra, for that testimony and all your work. And going now to my colleague, Councilor Tanya Fernandez-Anderson.
Thank you so much. Thank you so much, Madam Chair, and for your gracious accommodation of allowing me to make a statement. After Ms. Sandra McCroon, I really have a deep appreciation for Children's Services of Roxbury, using Ms. McCroon's words, because I have worked there, I have utilized their services after working there to collaborate with DCF as well as the courts when I had clients in public health sector, providing intensive care coordination, providing therapeutic mentoring, providing therapeutic and training supports, and providing community program supports, which is all under CVHI services under Mass Health. So for those of you who are not familiar, this is an agency that truly encompasses what wraparound services looks like. And they are not necessarily, or I should say, a lot of people mention this word sort of, as a jargon in campaigning or in the community, wraparound, without truly understanding with what that really means. And to have an agency that is Black-owned, that has provided services for over 5 decades, that is strong in our community, that is building capacity, that continues to show us what that example is of agency that, one, provides services that is impactful but effective, but also while building capacity, is truly, again, exemplary of what we need in our community. When I filed this hearing order to have some ARPA funds, even if it's a collaboration or through RFIs or contractual, maybe contracts through the Department of Public Health, but sort of that collaboration or partnership with wraparound and holistic services or agencies that provide those services, in order to not duplicate those efforts. I think that the BPA, Department of Public Health, can collaborate with already existing services, and I think that it's important for me as a Black woman to receive services from particularly providers that I know that I can trust, that I've built relationships with, that I can not feel insecure whether or not I've been misdiagnosed, whether or not I've been overdiagnosed or underdiagnosed. And I think that we should really be intentional when considering how are we building equity. A part of that building racial equity, I think, is looking within our own communities and really respecting the agencies that are already doing the work and partnering with them, but also partnering with our constituents, our citizens of Boston that are in need of those services, and understanding how to meet those needs. So I appreciate your indulgence, Madam Chair, and the time. I do apologize. I have a meeting to attend to, and I look forward to the hearing where I can invite the different example of these agencies to be able, and I would love, of course, we'll invite you as well, would love to have you on so that we can explore the partnership mentioned. Thank you so much.
Thank you.
Thank you so much, Councilor Fernandez Anderson. And now we will go back to a couple of folks for public testimony, and then I'll ask some questions. So we've got Julie Burns up next from RISE. Thank you for your patience, and then it'll be Marianne Frangules from MORE. So Julie, you have the floor.
Thank you so much, Madam Chair, and thank you, members of the council. My name is Julie Burns, and I'm the president and CEO of the RISE Massachusetts Foundation. I'd like to speak in support of the Health Commission's proposal to use ARPA funding to support innovative prevention and response models to mental health, substance use, and wellness that address systemic racial inequities through a comprehensive, coordinated citywide response. RISE Massachusetts is a statewide nonprofit dedicated to ending the overdose crisis, and it has been our honor to work with the Boston Public Health Commission toward our mutual goals of reducing stigma and reducing fatal overdoses. We share their belief that urgent workforce investments are critical if we hope to hold on to the gains made by the Wu administration at Mass and Cass and begin to address the root causes of mental health and addiction. To increase access so more people receive the type of care they need, we must also increase the number and diversity of providers, while providing opportunities for education and training so practitioners of all types are prepared for the ever-changing landscape of the overdose crisis. Therefore, we are particularly supportive of their plans for capacity building and training for Boston Public Health Commission and other city workforce to enable them to better support Boston residents, and staff development programs, training programs for the community, workforce resiliency programming, and staffing and support for staffing and administration functions. The Commission staff, especially those at the Office of Recovery Service and AHOPE, have worked tirelessly, often without recognition or support, throughout the pandemic, and they'll continue to do so during what is likely to be a difficult summer. Investing in this workforce is important and will literally save lives. I would also like to log our support for continued funding for the Engagement Center and community outreach teams. There is deep stigma and misunderstanding about the disease of addiction, and many people do not seek treatment because of the way they have been treated by the healthcare system. In fact, only about 11% of people with substance use disorders seek treatment. The Engagement Center is a critical low-threshold option for people unwilling to go to a traditional brick-and-mortar site. It also provides a person-centered space where outreach workers and clinicians can start to build trust and support individuals on a path to recovery if that's what they want. It's an important tool and should be funded appropriately. As a public-private partnership, RISE stands ready to work with the Commission and the Council to achieve the goals laid out by the Wu administration and request the Council's support for this important funding request. Thank you.
Thank you so much. Julie, thank you for testifying and for your patience again. Marianne Frangules for MORE, and then I'll go to my questions and then second round for councilors. Marianne, you have the floor. Can we get Marianne up?
I needed to unmute.
We hear you now.
Very good, that's wonderful. Thank you, Chair Kenzie Bach and all the City Council members for allowing me to speak. It was wonderful to hear from Dr. Odo Kuto as from the Boston Public Health Commission, as well as Jen Tracy from the Office of Recovery Services, the doctors from the Community Health Center, the services of children of Roxbury, as well as RISE, which we really appreciate in a great big way. I speak for more Massachusetts Organization for Addiction Recovery, which has demonstrated leadership in organizing recovering individuals, families, and friends into a collective voice to educate the public about the value of recovery from alcohol and other addictions. I can also say that I'm executive director. I'm a person in long-term recovery, as well as being a resident of Boston myself. We recognize that most individuals with addictions that have co-occurring mental health conditions. All has been exacerbated by the COVID pandemic. Alcohol and other addiction have reached severe heights, as witnessed on Melnia Cast, heightened overdose rates in unhoused populations. So we're grateful to be here in support of those ARPA fundings. We recognize too, very much so, that that the rates of all of this has heightened for more people of color. We support the $20 million to ensure an equitable response to the ongoing pandemic, as well as the $18 million to support behavioral and mental health, which is so important. $12 million for that new Center for Behavioral Health and Wellness is a great idea, with an overarching mission to reduce stigma, as well as a community-driven response, and to train a cultural responsive workforce. We've learned and relearned that people need a cultural lookalike that understands the culture and need of services. It's really important to have that $6 million for a public health response to the ongoing substance use and mental health crisis. And among those recommendations that we support is an increased support for harm reduction efforts. As mentioned, we see over and over those that working from AHOPE, they support and help people every day who are at the death or the door of death, and that help and support need incentives for what they do, because we don't want to see them burn out. And it's so important to keep the engagement center alive and well. We know that there is a need for a safe environment. We applaud the use of the center for the medical care and counseling. That's important. And we do understand, though, that the community needs it to be able to go in when they need to go in, as they need to go in. And that would include more support to ensure safety and de-escalation from any outside interference. The addition of 3 engagement center-like services in Boston neighborhoods where people or families living with addiction might get help to learn to navigate the system and know there is a place to go in their own neighborhood is really great planning. This will help to break the stigma and discrimination experience and get people to talk about it. We see this as a replication of the Boston Public Health Commission's PATHS, which stands for Providing Access to Addictions Treatment, Hope, and Support. And one-stop shop for anyone, individuals, families, community partners, other treatment providers looking for information about how to access substance use treatment services. We would like to add that it's probably not a bad idea to add in the establishment of Long Island to support an addiction recovery campus. This could be a place away from the hustle and bustle of the city with all of its triggers to have one-stop shopping for all recovery needs. And let's not forget prevention in all of Boston's neighborhoods. The Boston coalitions provide opportunities for families, schools, and activities to educate our communities about to live drug-free. Most importantly, they help our youth. We recognize all of the above requires incentives to build qualified staffing, and that means providing the equity that's needed to make that happen. Addiction and most mental health disorders are chronic. Accordingly, recovering from these disorders is a lifelong process, and many individuals require long-term support to sustain recovery. At Moore, we firmly believe in the value of peer recovery support services by providing peer recovery coaches as well as mental health certified peer specialists to help lower the barriers and provide the intensive support that people early in recovery really require. These services should be made available to offer support to all individuals during and after treatment, and even without treatment. In addition, we recommend the city continue to utilize the resources of the peer recovery support services, such as their own Safe and Sound Recovery Center, Phoenix in Newmarket Square, Recovery on the Harbor in East Boston, Divine Recovery Center in South Boston, and Step Rocks in Roxbury. We recommend that the city, and you will, continue to work with these recovery centers to make supports readily available to all residents, and which is truthfully important.
Thank you.
Will gladly offer our services to Boston residents to find a way to enhance these services, to use their voices, to share their stories with purpose, point, and passion, as well as navigate the system while moving to make public policy changes to build the way for the right services at the right time by the right provider with no wait lists in a recovery-oriented system of care. We're here to help.
Thank you.
We thank the Boston Public Health
Thanks so
Commission, the Office of Recovery Services for what they already do and deserve the necessary enhancements to support the community.
Mary Ann, thank you so much. I do have to cut you off just because we've got to keep going, but
I'm
thank you.
done.
Wonderful. Thank you so much for that statement, and thank you for your patience. All right, I'm going now to my questions. And thank you guys for your patience as well, and just all these different efforts. So on the wastewater, so is the idea that we're gonna actually have monitoring like closer to the, like at the level of the pipes kind of for different neighborhood areas?
Exactly. That is the idea. In discussions with BioBot, we talked about doing 10 neighborhoods so that we would get a better sense of what's really happening, and have a better surveillance sort of perspective on what's happening in terms of COVID-19.
And how much does that cost in terms of like installation versus like ongoing monitoring? Like how should I think about that?
So I would need to pull up the budget for that, and I could actually get you the specific line items for that post this meeting. We do have some estimates.
And do we have any sense of like, because I agree with you, it's such a useful tool, and I think it's been great that you guys have been using it so much, and that we've been ahead of the curve on that. But mostly, as you know, because it's sort of, it doesn't lie, right?
Mm-hmm.
Like, and you don't have to achieve testing to kind of know, like, okay,
Mm-hmm.
we've got an uptick here. Do you think that there are applications of that to other diseases, like going forward?
Absolutely. And just to speak about opioid use, I mean, you could actually detect that in the wastewater, so you actually have a better sense of what's happening across neighborhoods. So there are many uses, and we've been exploring that with BioBot to talk about what more we could do and not just focused in on COVID-19.
And fundamentally, in terms of like adding other things that we might want to know, like presumably it's the same sample that's being taken, it's just a question of what tests you're running on the sample?
Exactly.
Okay, great. Well, I think expanding that so that we have like this more accurate snapshot of the public health situation in the city in general is great. I just wanted to fly, with this point about the training for folks. I feel really strongly like our frontline city staff, really are definitely in that position you described. And I think we would all say that's true also of our council staff. Like, a number of, my staff have ended up being the sort of like frontline person for somebody in a crisis, right? And we have amazing staff here, but I think folks haven't had that training a lot of times. There's a lot of people who come into the council, it's their first job, or it's their first job in public facing services, and maybe they were at an office before, et cetera. So I'm kind of curious how you're thinking about, I can imagine a lot of demand for that. And I can imagine us coming to you and saying, hey, can the city council staff be on that list? So how are you thinking about managing that?
So there isn't a plan yet, to be quite honest with you, but there have been other trainings that we've offered, particularly in issues related to anti-racism policy, DEI, so we've done other things. I think that probably what we would end up doing is something akin to a pilot, and see how it works, see what the interest is, what the uptake is, and how training might work if it's, virtual, most likely, what is it that, sort of the time span of the training, and make it feasible. And, we're not going to be able, with this time-limited funding, to do everything we want to do, and I think has to be sort of understood in this, but is this something that we could scale up, with more resources in city funding over the years? It's not a problem that's going to go away,
Yeah.
so.
No, certainly not. Okay, yeah, so more to talk about there. And then this pipeline issue, I mean, you've alluded to it a couple of times, and it is a theme we keep talking about, but just, would echo Councilor Mejia on the fact that it just seems like, and you, right, that compensation is the name of the game. And so what I'm wondering about is, how are you thinking about, like, we invest in this pipeline, we want to have diverse individuals filling these roles, that need feels really strong. But no matter how much we're cultivating diverse individuals, like, folks are going to go elsewhere if the pay is better and the work is less hard. So one of the things that we've been stressing with the ARPA funds is how we create good jobs for Boston residents, right? Not just jobs, but good jobs. And in childcare, one of the things that we were talking a lot about last week was sort of like, how can we use our ARPA funds when we think about an enduring impact to kind of like help nudge the whole state, like childcare platform, like up in terms of what compensation norms are, and sort of use us as the leading edge, since we think the State House is likely to take up reimbursement rates and stuff next year on childcare. So I'm sort of curious, I don't really know where we are in the public health field, in the sense of, is there a similar opportunity for us to do something that would be pattern setting? And I didn't really see a reference to that in this. So.
Right. So I agree with you that that's really the challenge. I mean, people have to feel like there's a job that's, they will compensate them well at the end of the day. Otherwise, they're not going to engage in that funding or that training process, or they'll go and find some other sector to work in. And there are plenty of opportunities with so many people leaving jobs. What I would say is that we are at sort of stage one in this process with behavioral and mental health, and stage one has been talking to those providers who are looking to hire people. They're looking for people, and they don't believe that there are people out there. So what we're saying is, if you have the jobs and we can offer them at market rate, then we can find people who will train, and we can hopefully keep them here in Boston. So that's kind of what we're thinking, is that, you go through the training, here's an opportunity, here's something that we can offer you that will, compensate you well, here's training that you don't have to pay for per se, and that's a good opportunity for a lot of people, whether it be for recovery coaches, whether it be for therapists. I mean, these are the type of things that we're exploring right now.
So in that sense, are you looking to have sort of like hiring guarantees, like?
Actually, we've been contemplating that, absolutely. I don't know the full logistics of it.
Office of Workforce Development on this?
Yes, we are, absolutely. And we're talking to hospital leaders, CHC leadership, to see what it is that we could kind of arrange. And like I said, this is sort of step one in the process.
So I think the things I would say is, one, I really think the job guarantee thing is so key, and it's where we end up. It's just like, we just do not want to build bridges to nowhere for people, right? And so I just think, and saying to our employers, like, put it on the line. If you say what you really need is us to help create an employee ecosystem, then you got to hire the people who we're training. So I think that's a really important component, and I think, Trin was here last week saying the same thing in the life sciences space, so I just feel like we should all be on the same page there. And then I think one of the things we were talking about in our hearing back on the 3rd, our initial overview hearing related to a docket Councilor Braden filed, is just in general, we want to have compensation standards, even with just third-party contracting that we're doing. And, and I think that applies to our health centers, it applies to everybody, everybody, there's a certain kind of, nobody has enough money, and so everyone wrings their hands about compensation, but that still keeps it low. And I just think that when we talk about a Green New Deal, and the fact that the New Deal was about job creation, like really holding a line with our partners whom we love, that, hey, access to these funds means that people need to be having sort of these certain standards that make for a good job in the city, is, I think, an important framework to put on these dollars.
Absolutely, we totally agree.
So I think just flagging that, I think that's something that the council wants to understand, how we're gonna actualize, especially with money from ARPA that would go into like sort of third-party contract things. So flagging that out for later. And that is my time, and I'm gonna let Councilor Mejia go. Can we get her mic on? There we go.
Nobody tries to silence me. Just joking. So I know it's Friday, and I'm not going to ask you too many questions, I promise. I'm going to get you out of here. So I think it's just 4 little things that I can really want to just expand upon a little bit. I've been talking a lot about immigrants. And, you know, we have a huge population of foreign-born. And as we start thinking about COVID, recovery, renewal, and all that other good language that we use, when it comes to mental health and wellness, especially for immigrant communities, you know, our health is the last thing that we prioritize because we just don't have the time to consider that. We also, in communities, immigrant communities in particular, and I think all communities, there's a lot of stigma around mental health services. So can you just talk to me about any specific things that you're going to be doing around engagement and community awareness that is hyper-focused on immigrants? And not just about vaccines and like, I already know all of the efforts that are being done in that space. I'm talking about like, you know, other stuff.
So I was actually going to speak to the Center for Behavioral Health and Wellness. I think a lot of what we're going to be doing, particularly around this issue of stigma that you mentioned, is going to involve community engagement. And when I say community engagement, I don't think we can approach this looking at umbrella categories of people, like let's bring together the Black people, let's bring together the Latinx people or whoever. We have to drill down and get a better sense of who people really are. In terms of their ethnicity, in terms of their country of origin. So in the community engagement process that we will use to figure out what the campaign is going to look like, what the various campaigns will look like, it's going to be about getting to dig deep and getting the sense of who people are and what their perceptions are regarding mental and behavioral health.
That's great.
Otherwise, we're not going to get very far.
Right, and I just want to add, there's 2 things to consider as you move towards this, is that there is this perceived assumption that everybody knows how to read and write. And there are a lot of people who come here from different countries with interrupted education and don't know how to read and write. So as you consider your outreach efforts, also be super mindful that you have to think about audio and visuals and other ways, or even putting people's flags so that you can make sure that everybody has access to this information. So and that's gonna take some financial incentives and investments. So I just want to talk a little bit more about I think when we met, I talked to you about a program that our office created. It's the Mental Health Wellness Ambassadors Program, and we have young people that we've trained. We've partnered up with clinicians of color to design this, and we have young people, I believe 12 young people across the city of Boston, serving as mental health ambassadors, if you will. And we've learned a lot from them in terms of their own journey and then how they have become this bridge in connecting their peers to support services. And I think that there is an opportunity to really, as you start thinking about COVID and you start thinking about building out programs, that sometimes young people could be the best ambassadors around mental health and wellness. And I think that there is some opportunity there to tap into that and replicate. And then I think I also mentioned that we created a program with the hair salons and barbershops. So while you're getting your hair done, you're getting your head fixed, right? I kind of want to just talk a little bit about that because a lot of our salons and barbers that participated in that program have continued to be engaged with the clinicians and are still reporting that their clientele are experiencing mental health and wellness supports. So I know that you all created a program. You're working with Ian from Barber Time. Yes, I know you are, because we've been helping him with some of his outreach, specifically in the Latinx community. So I think that I'm glad to see that that program is being replicated, but I do believe that in terms of immigrant communities, that stigma, you know, that's a really good place for you all to build that program a little bit more. just something for you all to consider. And not all of these are going to be questions. These are just things for you all to consider and take note of. I didn't hear a lot about HIV and AIDS and substance use. I mean, I did hear some through the recovery lens and, that work. But I do know that there was an uptick in HIV and AIDS and also domestic violence during the pandemic. So I'm just curious about where does that land in terms of your goals and objectives and the work that you plan to be doing around that?
So in terms of HIV, yes, there has been an uptick, as you're well aware. I think that a lot of the work that we're doing in regards to harm reduction, in regards to pre-exposure prophylaxis, particularly with Boston Healthcare for the Homeless, have been incredibly important as we think about how we protect folks from both HIV as well as hepatitis C. So these are things that we're, very much so focused in on. I think that as a commission, we are very much so involved in the Ending the HIV Epidemic Collaborative, which is part of federal funding that comes to Suffolk County. We meet with them to discuss not only, risk transmission related to injection drug use, but also other forms of risk transmission, which still occur here in Massachusetts, though numbers and rates have been decreasing over time. There are still many people who are at risk. There are many people who are not getting access to testing, unfortunately, and who delay treatment because of issues related to stigma and issues that relate to a lot of what we said about in terms of mental health and other issues. I think it's also important to note that we offer HIV counseling and testing as well as other services, and we can talk more about that. You probably already know this through our AHO program and other services. So it's hugely important, and we probably should have said more about it, but it's core and key to all the work that we're doing.
Yeah, I just wanted to kind of uplift that as something that I know has bubbled up to the top during COVID. And just two more things that I'd like to offer. One is a question, and then it's something that I'd like to offer. In regards to the water testing, do people know? I mean, I've heard about it in the news. I'm like, according to the water pooling, blah, blah, blah. But does everyday people who aren't really watching the news know that their water is being tested for stuff? And is there a responsibility that we have?
It's not household level.
Oh.
It's so they've just been testing it at the whole central city facility.
I was about to say, that's
weird.
I'm like, I don't even want to pee no more. Like, what the hell?
That would create I think a private identifiable.
Okay, that's fine. Okay, great. So you don't have to answer that question, but I got alarmed. I'm like, oh my God, because there's also surveillance happening and drones being bought without our permission now. We can't even use the bathroom without, I'm just like, whoa. I needed to just find out. Okay. Don't worry about that answer. Okay, so then I do want to just offer, we have been in communication and developing a pilot. If you mentioned about that this is going to, we're just doing this because we have the capacity, we have the resources, we have the connections, and the folks who have the appetite to want to help do this work. We're going to be partnering up with the BTU, which is the Boston Teachers Union, MAMLEO, which is the Black and Brown police officers, SCIU, and these are frontline workers, right? We see these folks as all frontline workers, and creating this model where we're helping people identify their own trauma triggers, but because they're also frontline workers, if you will, so that when they show up to a scene or they're interacting, we're going to focus primarily those who serve families, because we want to be able to help support our most vulnerable families, so families who are court involved and things of that nature. I say all of this is that there are things that are already happening that can be replicated in partnership with other folks. And I always say this everywhere that I go, is that Boston is resource rich, but coordination poor. We have a lot of folks who are doing great work. What they don't have access to are people who are able to help replicate, scale, or expand, or to add an evaluation component to the work, to be a thought partner. And I think, and not because these are programs that I am involved with, but just in general, I think that we have a mentality here that is not in the collaborative spirit. And I would love to find ways to be able to be more collaborative. Absolutely. And also because I'm gonna have to vote on these things, I wanna make sure that I'm voting on things that are meeting the needs of the constituents. And I'm a citywide councilor, so I represent all 700,000 constituents. I wanna make sure that I'm being fiscally responsible for those who I'm here to represent. And I wanna make sure that what we're pushing for is reflected of the needs. And can you just talk to me a little bit about that?
The needs to collaborate.
The needs to collaborate and to be super intentional about I think, and I don't want to do this to you because I do this to everybody, but I really do appreciate PowerPoints, and then I really don't appreciate PowerPoints. And I think I'm going to go back to what Councilor Fernandez-Anderson said. I'm more interested in the outcome. Like, yes, this is a great vision, but I want to think about benchmarks. I want to know, like, dollar for dollar, what's going to be the return on investment? How do we know that the investments we're making are going to hit the targets that we're aiming for? And I don't think that the way we have been holding these conversations make me feel like I'm walking out of here knowing that these things on a implementation standpoint still feel like I'm a little bit unclear, like the mechanics of it. And I think that that's no fault of your own because you haven't even got the money yet. So how do you know how to do the outcomes and objectives and goals and all that? But with all that said, I just think that there needs to be something a little bit more urgent.
And I agree with you, Councilor Mejia. I think I'm very outcomes-driven, very data-driven in terms of how I think about the work that I do and in the work that the commission does. I think that step one is the vision. You know, step two is let's get the money to support the vision. And then step three, which actually started during step one, is pulling together this implementation plan, this operations plan, which includes the metrics, the outcomes. What's the process, but more importantly, what's the outcome that we're looking for, year one, year two, year three. That's all in process. I think that one of the things that is important is us, you know, sharing that with you along the way, as opposed to coming to a hearing. It is a bit challenging, and I don't think it's easy for you to grasp all the thought and everything that's gone into getting to those outcomes. Yeah. So I think that may be helpful just as we're thinking through these transformative investments and what they will actually look like.
Yeah, and I'll just say, because I know I see that gavel, oh my Lord, is that, I also just think because then it just feels transactional, right? I don't want to ever feel like an ATM. Like, I want to be a partner in the work that you all are doing, even though I don't work for the commission, but I'm deeply invested in the work that you're doing because that's the work that I come from, right? Like, when the Peer Institute was under the Boston Public Health Commission, that's the work that I did back in the 90s. So I'm deeply committed to the work. I just feel somewhat disconnected. And I don't think that that's something that I can fix here in this chamber. I just think that that's just a matter of being in government. I just have to come to terms with that. This is the environment that I'm in right now, and I just have to just deal with it. But it just doesn't, there's something that's missing, and I just can't name it. But I appreciate you receiving the feedback, and I look forward to building meaningful partnerships to move the needle. And I really do appreciate your leadership. And I've gotten a lot of folks who have spoken so highly of you and that they're so happy that you're in your role, and I want to be supportive.
Thank you. Thank you. We look forward to partnering more and, you know, sort of working on all these projects with you.
Thank you. Thank you so much, Councilor Mejia. I have a second round of questions, and then we'll wrap up. So if anybody is intending to testify, you should sign up in the corner right now, or you should email us at ccc.covid19@boston.gov and get into the Zoom straight away, because otherwise we'll be concluding the hearing. So I guess, just to follow up on what Councilor Mejia said, it does feel to me like there's a real distinction here between, like, programs that you guys have been running that you need extensions of funding for, or you're taking the next step, like with the wastewater thing, right? Where it's like super clear where the dollars would be going and the need and all of that. And then it feels like with the behavioral health thing, the need is super clear. Like you said, we're talking about it all the time in the council. Everyone feels it all over the city. But it feels like so far like a sort of sketchier set of proposals. Just like it feels like, and maybe that's because like you said you're hiring the chief behavioral health officer, right? But you haven't hired him.
We have hired him.
Oh, you have
Yes,
hired.
we
Okay.
have. We just haven't made a full announcement yet.
Okay. So but they've already started.
They started June 1st.
Okay. All right. This week. Got it. And so is that person partly tasked with sort of fleshing this thing out?
Partially. I think that this person will be looking at what it is that we need to do citywide in terms of collaboration, in terms of building capacity to support better behavioral and mental health services across the city. And that will likely come in the form of a plan, which I think we discussed, at other hearings, that I think will be very useful to understand both where we are, where we want to go, and then hopefully where we will end at year, say, 2, over time.
And do you how is the plan interacting with the center?
So it's really one and the same. The center is meant to support the plan, but the center is also operating as a initiative where people will collaborate, as I said, to work on, say, workforce, to work on communication and stigma, and then to work on this capacity building piece. Those would all be part of the plan, but there'll be other things that'll be part of the plan. I think that there's a lot that we need to work on. There's a lot of capacity that needs to be built, and I do think that we could use the center, and it may sound a bit gray area right now, and I acknowledge that, and that's largely because I think that we need to dig in and get down to what it is that we really want the center to be. But as I said in my presentation, it's clear what we want our first 3 priorities to be. And we have had discussions about them, but the specifics of that are going to be decided, I think, in time.
Yeah, got it. No, and I think it gets back to this, and we're all trying to figure out this chicken and egg thing of the council's, like I said, the council feels this huge pressure around this funding and making sure that it goes right, that it goes to the right things, and that we in the long term feel like we had this moment and we helped to appropriate to things that were really critical for the residents of Boston, and they bore fruit, right? So I think a lot of what you're hearing is like people want to sort of see enough of the seeds to know it's going to bear fruit, and at the same time recognize that, especially when you talk about capacity, like it's chicken and egg if you need the personnel in order to figure out the thing. So I think that's what a lot of us are struggling with. And am I right just looking at this? So the center, it's a 6 million ask, and then sorry, is the 4 inside of that, or is that another 4? So you've got I'm
just going back to.
I'm just back. Sorry, I'm just inside. I'm back in the 525, the detailed doc. So is it 6 and 4 and 2, or is it 4 and 2 are inside the 6?
Counselor, it's the 6, the 4, and the 2.
Okay, so
totaling the 12 million
so
for the center. Okay. And this is all sort of in addition to the funds that we're going to receive through the city appropriation process, which is the 4 new FTEs that will make up this particular center.
Right. And so when I look at that, I think, so that's in terms of personnel, just looking at your 10%, so that's 1.6 million towards personnel across those 3 programs. And so can you give me a little bit more sense in those 3 buckets of what we anticipate those personnel hires being? Like we must have some back of the envelope for getting to those numbers. And then how do we think about, because obviously, again, one of our challenges, right, is how do we seed things that could become permanent without creating a ton of cliffs where we've funded personnel who we won't be able to fund in 3 years. So, and obviously I know the 1.6 is over the ARPA period, so it's not like a 1.6 recurring. But just, can you talk to me a little bit? Do you have a sense of what that personnel expense is across those 3 things?
So Right, so you have more? Oh, okay. So essentially, the way that we looked at the center is that it, as I mentioned, we based it at the Boston Public Health Commission. The Chief Behavioral Health Officer will be supporting the center, but then there will also be these other 3 FTEs that will be specifically assigned to the center, and each one of these individuals will have a carved out scope of work. So essentially, there might be one person who is the Director of Workforce Development, and I've mentioned a number of things that I think would constitute a full-time job under workforce development, and that person would certainly be working across the city to accomplish the many tasks that we've articulated. Within the center, there may also be other people who are already at the commission. So for example, so the public health response to addiction, that certainly falls within this idea of the center, this idea of behavioral health wellness. And so that might be somebody, you know, who is very much so focused in on what's happening, you know, sort of across the city in terms of recovery treatments, the sort of broad gamut of the continuum to address the needs of individuals that are experiencing substance use disorder. In addition, there may be somebody within the center who is focused in, for example, in some issues related to communications and stigma and reaching communications and an expert in health communications. So that may be another person who's, you know, within the center who may be dealing with a specific scope of work. We also need administrative support within the center in order to do all the things that we're talking about in terms of collaboration, building this external advisory committee, helping to develop this plan. So there are many things that we have in mind to do with these specific FTEs, and we built the budget around how much it is that we know that we would actually need to have to support those FTEs.
So I just think that the committee needs that more detailed budget breakdown, because I do think, and we're asking BPS the same thing, like, it's a question of, like, we all know that everything that we do on whether it's ESSER or ARPA that then needs to be sustained is going to ultimately come to this council out of the operating budget, right? 3-4 years from now. And so I just think the council, it's not that we can't bite off any of those things, because like, again, we've talked about there are some critical needs where we just like have to up the personnel, but we need to, you know, we're throwing the ball in the air out to our future selves to catch. And like, we gotta know how many of those balls we're putting in the air and what the expectations are that we're setting up. And I just think the count, like, so that distinction of sort of like, and also there's something different, like, because the personnel line on this report that we got from you, it's helpful, but there's something different between, oh, like, we're gonna have a short-term contract and I'm hiring some administrative capacity to manage that short-term contract, which then will be unnecessary once said contract is finished, versus like, we're planning to put basically on the books people who we hope will shift over in the long run. So I just think that's one of the sort of core fiscal questions that we've got to understand a little bit better about these. And probably it's easier to do a follow-up, like documentary, than to have you try to narrate through it.
Right.
Yeah, and then I was just gonna, I think similar, it would just be helpful to understand on the health center money side, is that all just like RFP'd out and then you see who responds? Like is that how that works? Okay. And then the summer program, is that in partnership with SuccessLink? Like, is that or is it its own thing?
I'm sorry, the summer program?
Isn't there a summer program people had to apply by April 30th? It was in the slides. I could be losing my mind, but.
Are you talking about?
Maybe it's.
Oh, you meant BAHEC's summer program?
I do mean BAHEC summer program, yes. So is that just a flyer showing the type
That's
of
all
thing?
it is.
Okay.
That's all it is.
Sorry, I took that as more informative than it was. Okay, so
Right.
so BAHEC has a summer program, which may be partnering with SuccessLink, who knows? But you guys are sort of referencing that as an example of the type of thing you got to do with workforce development.
Right, so BAHEC is the Boston Area Health Education Center, which you probably, you know, are very familiar with. And it may be sort of a platform or an example of what we can do to build more, behavioral health, mental health pipeline initiatives at the commission, given that it has been successful.
Yeah, I think, and the thing I would just say, and I sort of already referenced this, but just like you guys are the public health experts and we all reach out to you about public health challenges in the city, even if it's other departments having them, I would say like the Public Health Commission is not going to become workforce development experts. So like, and this wheel has been invented both well and poorly many times before. So just, I think like really making sure that if we're going to put really substantial funds into a workforce development pipeline, that it's like best practices and that there's that kind of, that humility of saying, hey, we need the folks who really know about this. Because I think we all have had the experience of workforce development things that don't go anywhere. And it's just one of the more frustrating, because it's like if we don't create the pipeline, then we should have just divvied the money up across the participants, right? Like, right? If I'm gonna have somebody sit in a training program and then there's no job, then like, it's just, it's always disappointing. And so just, yeah, we'll definitely want to follow that with interest. But thank you for, so, we'll have some committee follow-ups, but thank you guys so much. And I will go to Councilor Mejia for a final word.
I thought we had like a third round of questions.
All right, but
No, sorry.
being mindful of Friday afternoon, but yes, Councilor Mejia, any final questions, go ahead.
Don't put on your mask, we're here until tomorrow. No. I didn't see any mention around violence prevention, and I know that the city has public safety and they have SOAR, but I do know that there is the intersection of mental health and wellness and violence, and so just, are you utilizing any of these dollars to look at violence prevention?
So the Boston Public Health Commission already runs a number of violence prevention as well as violence response programs, including the neighborhood trauma teams, which have been very successful, and you are well aware of what they do. What our hope is with this center is that we'll be cross-pollinating and building, and I don't want to say building capacity, I suppose I don't want to say building capacity, but building support for all of these initiatives.
So they're interconnected.
Exactly.
Yeah,
so
exactly.
they're truly interconnected.
That's great.
And so if we're building a pipeline, that pipeline may be that, look, we're looking at folks who are specialists in violence prevention, or in trauma response. So I think all of this is meant to feed into each other.
Yeah, I love that. And I think that's really important to continue to uplift, because going back to the resource rich but coordination poor, is that oftentimes our families are shopping in a number of different places just to eat, right? And they could have all their needs met in one place. So I think that that's really brilliant, and I really do appreciate that. In terms of the community-based RFPs and programs, what I hear often is that there are a lot of smaller organizations that have absolutely no access, but are doing tremendous work. And I'm just curious about, how do you plan to utilize these funds and being super intentional about creating space for some of these smaller, grassroots organizations to also be part of your pool?
So we have an equitable procurement plan policy that relates to some of what you're saying, meaning that not only are we talking about smaller entities, but diverse entities, because they are oftentimes left out of these grant processes, as you well know. So that has been established, and we have sort of a checklist as we're going through, vendors or grantees, that allows us to understand exactly what our outcomes are. Because again, this goes back to, well, what are we doing with our dollars? So I think that's very important. The other thing is that, we've made an intentional effort, I think, over the years to offer funds to smaller entities. When we get larger sums of funding for different, reasons, we've divvy that up and helped people by giving them smaller sums of money. There's a pro and a con to that, right? Because, the pro is that, we're reaching into smaller groups, smaller organizations. The con is that, I mean, the reality is if we want to truly build sustainable entities that can do the work, then we should be giving them larger sums of money, and that leaves out certain people. So it's balancing that,
Yeah.
and that's part of the process that we're just going to have to go through as we look at these funds that they are awarded.
Yeah, I just think of something for us to continue to monitor. And the last thing, I have a question for the chair. Is that okay?
Yeah,
I'm just, in terms of process. Because, I'm going really hard on the Youth Development Network situation, and they're not listed in this little PowerPoint presentation, or so in the next step, at some point, we're gonna have to say yay or nay to this, right? Or to these proposals, but I just wanna make sure that there is some, I need to see that the time that we spent here
Was worth it.
right?
Yes.
So that y'all not coming back to me with the same PowerPoint presentation that I'm gonna vote yes or no on something that I already spent 3 hours listening to, and that nothing that you heard from any of the counselors that were here was implemented or considered.
That will not be happening.
Yeah, so I just wanna be really clear about that, because that goes back to community engagement, and even though I'm a city councilor, I still feel like my voice matters here. So I just wanna be really clear that I am gonna be really, looking at some investments for the Youth Development Network. And I think that we have an opportunity to really support young people who are chronically absent. I was one of those kids. And so for me, this is personal. And I continue to work with them, and I want to make sure that we're utilizing our dollars to make sure that we can get these kids back into schools, because they're struggling. And so it's a win-win for everyone, including Boston Public Schools that are struggling right now too. So I just want to underscore that advocacy there, Chair.
Absolutely. Already circled in my notes, but I appreciate it, and yes.
Okay, so I think the world knows that I want that.
And are you okay? You good?
Oh yes, and thank you very much for spending the afternoon with us. We really do appreciate it.
And sorry, Dr. Hodakuchi, I have one in a similar gray zone between the budget and the ARPA. I think when you guys were here for budget, we talked about the sort of lack of definition of what was happening with that 1.75 million. And I think I underscored then, it's super important that, to me, but also to a lot of community advocates, that in the sort of shuffle of that money over onto the BPHC side, that real money be held for actual implementation of a non-police response pilot for mental health 911 calls. And I think there's a lot of unclarity about where we were on that. So have you gotten any more clarity?
I think that there's still a lack of complete clarity on that. I think what's happening now is that some of that money is going to the community-led design group, which is what we discussed, and that hopefully there will be
by October or something.
Exactly, by the fall. The remainder of the money, some of it is planned to go to EMS, and some of it potentially to be discussed with the new police commissioner. And I think that there's been some, desire to wait and sort of see what that discussion, what comes out of that discussion. I have to say that I do understand the urgency and the concern, and we are working on this. As soon as we have a better, more clear response, we'll certainly get that back to the City Council.
Okay, but just, I think, being mindful of the fact that this is the month in which the council is deliberating on and voting on the budget, and that is, I think, quite important to a number of us. And also, I would just stress that in the initial process around that money, there was an effort to have all of it only go to co-response models, and there was a huge pushback, and that's how we ended up with the community-led pilot, right? Was the idea of, hey, that's how we ended up at a 3-stranded space, right? Because there was a kind of initial response at the department level of kind of let's keep this all in co-response stuff, and really community advocates who had pushed for the funding were like, no, we're trying to dream about an unarmed response model. And so I think it's it's worth knowing, because you didn't own it through that whole process, that I think for folks, it feels like kind of round 2 of the same argument about, is there going to be any money left for the thing we were actually dreaming of at the beginning when we advocated for this money, which was not to have it all go to co-response. So I just think that carving out that space for a pilot is really important. And I think people are I think I and lots of others are very comfortable with the idea that, yeah, this is an area where, yeah, you don't know what the process is going to recommend, so you can't say exactly what it would end up going towards, but the idea that we would run a process and they would make a bunch of recommendations in the fall, and then there'd be no money to launch anything is a hard sell. So, just reflagging that up. So, yeah. All right, and that concludes for me and from Councilor Mejia, and I don't think we've had anyone else sign up for public testimony, so thank you again both for being with us for 3 hours today, and also for just the tremendous work that you guys do at the commission. I mean, and have been doing just like total warriors through this whole 3-year process. Really appreciate it. And Jen, I didn't get to ask you any questions, but continue to always really appreciate the ORC work.
Thank you, I appreciate it.
All right, and with that, this hearing is adjourned.
Thank you.
Thank you all.